The Senate will come to order. Mr. Schaffler, please call the roll.
Senators Amabile, Baisley, Ball, Bridges,
Excuse.
Bright, Carson, Catlin, Cutter, Danielson, Doherty, Exum, Frizzell, Gonzalez, Henriksen, Judah, Kipp, Kirkmeyer, Kolker, Liston, Lundeen, Marchman, Michelson-Genet, Mullica, Pelton B, Pelton R, Rich, Roberts, Rodriguez, Simpson, Snyder, Sullivan, Wallace, Weissman, Winter. Mr. President.
Let's do this. The morning roll call is 34 present, 0 absent, 1 excused. We have a quorum. Senator Mullica, the good Senator Mullica, would you please lead us in the Pledge of Allegiance?
Thank you, Mr. President. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Approval of the journal. The good Senator Catlin.
Thank you, Mr. President. Members, I'm down here to ask for you to approve the journal as corrected by the Secretary of the Senate. I don't have a script here, but by the end of this week, I'm sure I'll know this by heart. Anyway, right here.
That's pretty good off of memory.
It's not memory, it's just, I move that the Senate Journal of April 4th, 2025 be approved as corrected by the Secretary.
You've heard the motion. All those in favor say aye. Opposed, no. The ayes still have it. That motion is adopted. Senate Services.
Correctly printed, Senate Bill 276, 277, 278, 279, and 280. Correctly engrossed, Senate Bill 200. Correctly re-engrossed, Senate Bill 204. Correctly re-revised, House Bill 1006, 1010, 1060, 1087, 1113, 1132, 1135, 1147, 1148, 1152, 1165, 1168, 1172, 1182, 1185, 1224, 1234, 1247, and 1280. Correctly enrolled, Senate Bill 85, 86, 87, and 143. Senate Joint Resolution 8.
Conference Committee reports.
First report of the First Conference Committee on Senate Bill 199 to the President of the Senate and the Speaker of the House of Representatives. Your first Conference Committee appointed on Senate Bill 199 concerning suspending legislative interim activities and in connection therewith reducing an appropriation has met and reports that it is agreed upon the following: that the House recede from its amendments made to the bill as the amendments appear in the re-revised bill and that the following amendments be substituted therefore. Respectfully submitted, Senate Committee Majority Leader Rodriguez, Chair, President Coleman, Minority Leader Lundeen, House Committee Speaker McCluskey, Chair, Majority Leader Duran, Minority Leader Puglisi.
Message from the House.
The House has passed on third reading and transmitted to the Reviser of Statutes House Bill 1312, amended as printed in House Journal April 4, 2025. The House has passed on third reading and transmitted to the Reviser of Statutes Senate Bill 129, amended as printed in House Journal April 4, 2025. The House has passed on third reading and transmitted to the Reviser of Statutes House Bill 1309. The House has passed on third reading and returns herewith Senate Bill 183.
Message from the Reviser.
We herewith transmit without comment House Bill 1309, without comment as amended House Bill 1312, without comment as amended Senate Bill 129.
Surprise, surprise, surprise.
Majority Leader Rodriguez.
Thank you, Madam President. I motion that we proceed out of order so the president can have a moment of personal privilege.
You've heard the motion. All those in favor say aye.
Hey!
Those opposed, no. The
Wow.
ayes have it, and the Senate will proceed out of order for moments of personal privilege. Senator Coleman.
Thank you very much, Madam President. I request a moment of personal privilege.
Granted.
What? Thank you very much, Madam President. Members, the Senate of the Colorado Legislature convened in the first regular session of the 75th General Assembly hereby extends our warmest congratulations and commendation to Charlotte Figi. The good senator from Colorado Springs, join me. April 7th is recognized as Charlotte Figi Day in Colorado. In Charlotte Figi's 13-year life, the impact of Charlotte's journey made is immeasurable. Her role as a pioneering patient created access to hemp therapies for millions around the world. We're joined by Charlotte's family here to my right, your left. Charlotte was the inspiration for the launch of the Realm of Caring Foundation, a nonprofit charitable organization established to guide suffering families through their hemp health journey and conducting revolutionary research worldwide. Charlotte Figi's deeply committed families share their journey and challenges to assist families in similar situations. Charlotte was rightly known as the girl who was changing hemp laws across America. Her mother, Paige, continues this work through her organization, Coalition for Access Now, around the nation and at the federal level. Charlotte's story inspired the Charlotte's Web Medical Hemp Act of 2014 and many other legislative efforts around the world. On April 7th, 2020, Charlotte Figi passed away, having left the world with a life-changing story of overcoming adversity through courage and grace. We take this day to remember her and her family at the request of all of us, given this 7th day of April 2025 here at the state capitol. Members in attendance, we have Paige, Charlotte's mother, Greg, Paige's husband, Max, Charlotte's brother, Chase, Charlotte's sister, Matt, Charlotte's father, Aspen, Matt's wife, Carson, stepbrother, Nicholas, stepbrother, and also we have Sasha, Executive Director, Realm of Caring, and Heather, co-founder, Realm of Caring. Members, please join myself and Senator Exum in acknowledging this family. Thank you all for joining us. Welcome to the Senate.
Senator Henriksen and Pelton B.
Thank you.
Yep, yeah, I'll go ahead and go. Thank you, Madam President. So I have a tribute here. It's military. Oh, I'm sorry. May I have a moment of personal privilege?
Granted.
Thank you, Madam President. So today is Military Family Day, or Kids Day, actually. So I have a tribute here that I'd like to read. Children of military families in celebration of Purple Up Day. Members of the Colorado General Assembly proudly recognize the sacrifices made by the children of military families on Purple Up Day. These children face unique challenges demonstrating remarkable strength and resilience as they support their enlisted family members, often enduring long periods of separation. The deployment of a parent, or sometimes both, on full-time military duty, including active duty service in the National Guard and Reserves, directly impacts their lives. We acknowledge our responsibility to support these children, ensuring they have the resources and encouragement needed to succeed in life, educational pursuits, and community involvement while their parents are deployed. As April marks a month of the military child, we urge all Coloradans to wear purple in recognition of the sacrifices military children make on behalf of our country. On the request of Senator Nick Heinrichsen and Byron Pelton and Representatives Matthew Martinez and Bob Marshall, given the 7th day of April 2025, State Capitol, Denver, Colorado, with the President of the Senate, signed by the President of the Senate, James Rashad Coleman, and Julie McCluskey, Speaker of the House.
Senator Henriksen.
Thank you, Mr. President. May I have a moment of personal privilege?
Granted.
Colleagues, please be seated. Thank you. As mentioned in the tribute itself, when you endeavor to serve in the military, as a soldier, sailor, airman with a family, that service is not just yours alone, it is your entire families that serves with you. And the sacrifices that are told upon you are told upon the family members as well, the spouses and the kids as well. So, you know, the kids that we have with us here today are kids who are sacrificing for our freedom, alongside their parents who are serving and sacrificing for our freedom. I got on the plane that to fly to Iraq on the day that my son turned 1 month old. And so that's something that he has experienced both then in his earlier stays and then in training missions that followed, in the Kosovo mission that followed, long periods of separation. These kids have all endured long periods of separation away from their families, their parents. It's just one of the things that's just a fact of life that comes with military service. And I really appreciate you all being here with us today because this is what that sacrifice is for. It is not always pretty. It is always imperfect, but it is the best form of government that we have ever seen on earth, which is a constitutional republic girded by pillars of democratic institutions, and you have a chance to see it in action here today. So I appreciate you being here, and I appreciate the sacrifice and the service that you're making so that your parents can sacrifice and serve for our country. Thank you very much.
Senator Michelson-Janae.
Thank you, Mr. President. As a military grandma, I'm coming up here to say thank you to Evelyn and Callahan for being really great kids when Daddy goes off to serve, and even when Daddy's serving from home. You're awesome with Mommy, and Granddaddy and Bubby love you.
Very good. Thank you all for joining us. Members, please join me in recognizing these individuals here in the back. Thank you for your service. Welcome to the Senate. Majority Leader Rodriguez. Special Order Second Reading of Bills. Majority Leader Rodriguez.
Thank you, Mr. President. I move to lay over special order second reading of bills until tomorrow, Tuesday, April the 8th.
The motion is to lay over the Special Order Second Reading of Bills calendar Tuesday, April the 8th. All those in favor say aye. Opposed, no. The ayes have it. And Special Order Second Reading of Bills calendar will lay over until Tuesday, April the 8th. Third reading of bills. Final passage. Mr. Schaffler, please read the title to House Bill 1161.
House Bill 1161 by Representatives Valdez and Senators Kipp and Wallace concerning requiring the labeling of gas-fueled stoves.
Senator Wallace.
Thank you, Mr. Chair. I move. No. Go ahead. You can go ahead.
Or Senator Kipp.
Yes, we move HB 1161 on third reading and final passage and ask for permission for a third reading amendment.
Senator Kipp, would you please tell us the reason for a request for an amendment on third reading?
Yes, so what our bill does is it requires that display models and websites have a sticker on them that will take you to a website. We had a request that we added the terms credible and evidence-based material to be found on that website, and so that's all this amendment does, is ensure that people are getting credible, evidence-based materials.
The question for the body is Senator Kipp's request for permission to offer third reading amendment. All those in favor say aye. Aye. Opposed, no. Well, the ayes have it and permission is granted. There is an amendment at the desk. Mr. Schaffler, please read L15 to House Bill 1161.
Amendment L15, amend revised bill page 3, line 18, after with, insert credible evidence-based.
Senator Kipp.
That's all it does, credible evidence-based. We all like credible evidence-based information.
Further discussion? Seeing none, the motion is the adoption of L15 to 1161. Are there any no votes? Senators Frizzell, Catlin, Liston, Pelton R., Rich, Carson, Baisley. With a vote of 27 ayes, 7 noes, 0 absent, 1 excused, L15 is adopted. Further discussion on 1161. Seeing none, the motion is the passage of House Bill 1161. Are there any no votes? Senators Simpson, Mr. Minority Leader, Mr. Majority Leader, Pelton B., Kirkmeyer, Rich, Bright, Carson, Catlin, Baisley, Pelton R., Liston, Roberts, Gonzalez, Mullica. With a vote of 19 ayes, 15 noes, 0 absent, and 1 excused, House Bill 1161 is passed. Co-sponsors. Mr. Schaffler, please read the title of Senate Bill 200.
Senate Bill 200 by Senators Kolker and Mullica and Representatives Hamrick and Soper concerning targeted measures to encourage early elementary academic success and in connection therewith updating methods for assessing certain skills, identifying struggling readers, and supporting students with dyslexia.
Senator Kolker.
Thank you, Mr. President. I move Senate Bill 25-200, encourage an aye vote.
Further discussion. Seeing none, the motion is the passage of Senate Bill 200. Are there any no votes? With a vote of 34 ayes, 0 noes, 0 absent, 1 excused, Senate Bill 200 is passed. Co-sponsors, Senators Pelton B., Kirkmeyer, Frizzell, Bright, Doherty, Amabile, Carson, Rich, Roberts, Pelton R., Liston, Baisley, Catlin, Mr. Majority Leader, Cutter, Snyder, Danielson, Marchman, Wallace, Ball, Gonzalez, Judah, Winter, Michelson Janae, Weissman, Henriksen, Exum. Please add the president. General orders. Second reading of bills. Senator Roberts.
Thank you, Mr. President. I move that the Senate resolve itself into the Committee of the Whole for the consideration of general orders, second reading of bills.
You've heard the motion. All those in favor say aye. Aye. Opposed, no. The ayes have it. The motion is adopted. The Senate will resolve itself to Committee of the Whole for consideration of general orders, second reading of the bills, and Senator Roberts will take the chair.
The committee will come to order, and the court rule is relaxed for everyone in the chamber. Mr. Majority Leader.
Thank you, Mr. Chair. I move the Senate lay over Senate Bill 127 until Wednesday, April the 9th.
The motion is to lay over Senate Bill 127 until Wednesday, April the 9th. All those in favor say aye. Aye. Those opposed, no. The ayes have it, and that bill will lay over to Wednesday. Mr. Schaffler, will you please read the title of Senate Bill 196?
Senate Bill 196 by Senator Judah concerning measures to protect insurance coverage for preventative health care services.
Senator Judah.
Thank you, Mr. Chair. I move SB 196 and the committee report.
There's actually no committee report, so to the bill.
Thank you, sir. I have an amendment.
There is an amendment at the desk. Will the clerk please read L006?
Amendment L006, amend printed bill, page 2, line
Senator
3,
Judah.
strike.
Thank you, Mr. Chair. I move L006.
To the amendment.
Thank you, Mr. Chair. So the amendment, stand by. It addresses industry's concern about HSA and to exempt them if necessary to maintain their status under federal law. The amendment also addresses industry's concern related to modifications or recommendations made by the Nurse Physician Advisory Task Force of Colorado Healthcare and directs them to consult with clinical experts, patients, and insurers when making recommendations related to preventative services, and I ask for an aye vote.
Is there any further discussion on L006? Seeing none, the motion before us is the adoption of L006. All those in favor say aye.
Aye.
Those opposed, no. The ayes have it, and that amendment is adopted. To the bill, Senator Judah.
Thank you, Mr. Chair. Members, we are here to present SB 196. The bill is quite simple. It's about ensuring that Coloradans continue to access preventative services to keep them healthy, regardless of what may happen at the federal level. The ACA's requirement for no-cost coverage to preventative services has long been one of the most popular aspects of the law. A majority, 82% of Americans, have a favorable opinion of the ACA's no-cost preventative services. The Kaiser Family Foundation analysis of claims data found that in a typical year, about 6 in 10 people with private insurance, or about 100 million people, received at least one preventative service of medication under the Affordable Care Act. These services are already covered, and with this legislation, we are protecting the status quo going forward should anything happen to the 3 expert bodies that determine what services are considered preventative services. Under the Affordable Care Act, carriers are required to cover a variety of preventative services as recommended by 3 national expert bodies: the U.S. Preventative Service Task Force, the Health Resources and Service Administration, and the Advisory Committee on Immunization Practices. High-quality preventative care helps Coloradans stay healthy, avoid or delay the onset of disease, lead productive lives, and reduce costs. Before the ACA, many individuals were deterred by co-payments and deductibles and delayed getting these essential screenings and immunizations. I just want to mention quickly that examples that are currently covered of preventative services include screenings of blood pressure, diabetes, cholesterol, and cancer screenings. Cancer screenings, diabetes, and cholesterol. Your well child visits, developmental assessments, prenatal care, screening for vitamin deficiencies, and women's health includes mammograms and cervical cancer screenings.
Senator Mullica.
Thank you, Mr. Chair, and thank you to the good sponsor from Aurora for allowing me to get on this bill with her. Members, this bill is quite simple. It's about protecting preventative health care. And not to overly politicize this by any means, but we want to make sure that in Colorado that access is stable, that no matter what the federal government is doing, no matter if there's instability at the federal government, that the people in Colorado continue to have access to that preventative health care. And the reason that we want to make sure that that happens is because when the people of Colorado don't have access to that, when they're not going to their doctor, when they're not having those screenings, when we're not catching these illnesses early, they end up in the hospital. It becomes more expensive. They end up in the ER. They end up being admitted to the hospital. Not only is it more expensive, they have worse outcomes. And so what we're trying to do here is we're saying, look, federal government, you may be looking at doing a lot of things, you may be looking at changing a lot of things, but here in Colorado, in this area, when it comes to preventative medicine and preventative health care, We are going to keep that stable, and we're going to make sure that the people of Colorado continue to have access to that care. We're going to require that to make sure that they have access to that care, because we want to make sure that the people of Colorado are getting the best care possible and that they're not ending up in the hospital because they've lost that access. And so we may hear some arguments today. We've heard some arguments in stakeholding already about the politics of this. But at the end of the day, this really is about one thing. It's about the people of Colorado. It's about the patients that I take care of. And it's about making sure that they have access to preventative medicine so that they're not more sick and that they're not coming into the ER and they're not getting admitted to the hospital because of lack of access. I ask for a yes vote.
Senator Rich.
Thank you, Mr. Chair, and I'm going to rise with a few concerns that I have with Senate Bill 196. I love the title. I mean, who doesn't want to protect insurance coverage for preventative health care services? But I do disagree that it should not, when the bill talks about just whatever Colorado wants to do and not aligning with the federal government. And with that, you bet.
There is an amendment at the desk. Will the clerk please read L003?
Amendment L003, amend
Senator
printed bill.
Rich.
Thank you, Mr. Chair. I move L003.
To the amendment.
Thank you, Mr. Chair. This amendment, and the reason I bring it is because it limits the commissioner's authority by prohibiting the adoption of enforcement of rules related to additional preventative health care services unless those rules align with federal recommendations. This ensures that any such policies remain grounded in the most current health research and evidence, promoting consistency, credibility, and forward progress with our government systems. I think it's an unintended consequence when you are going to allow a task force to make these decisions, and I ask for an aye vote on L003.
Senator Mullica. To the amendment, Senator Mullica.
Thank you, Mr. Chair, and thank you to the good senator from Grand Junction. And I would ask for a no vote, members. What this bill is trying to do is actually trying to bring this conversation and these decisions back to the state level to make sure that we are protecting that access to the preventative health care and not allowing any dysfunction or disruption that's happening potentially at the federal level to trickle down, at least in this area, for the people of Colorado. And so I would ask for a no vote.
Senator Baisley.
Thank you, Mr. Chairman. Yeah, I'm in support of this amendment, and I would urge an aye vote. This addresses the potential scope creep of the authority of the insurance commissioner. So I think this is a good, sober approach to improving this bill. And I understand the bill, but I think that we do need to be cautious about increasing an unelected member's authority over the people and their insurance. So I urge an aye vote.
Senator Lundin, Mr. Minority Leader.
Thank you very much, Mr. Chair. I rise in general opposition to 196 and in support of the amendment 03 that simply says that we should stay in line with federal recommendations. Boy, there's a moment to capture Lundin actually saying we should stay in line with federal recommendations. Why on earth would he say that? Well, currently, what the bill seeks to do is to freeze medical provision, health care, and what is provided, what is cared for, what is allowed, what is not. It seeks to freeze it in a moment in time, essentially. Colleagues, if you would, travel back with me 250 years ago when the founding fathers of our country were seeking medical care, and at that time, at that moment in time, the preferred method of addressing the circumstance that George Washington, soon to become the father of a country, the preferred medical recommendation was, we need to bleed him. Somebody get the leeches. If we froze our medical care in a moment in time, we would end up with that sort of absurd response to the circumstance in which we find ourselves. Currently, the elements that this bill seeks to freeze in time and reduce down to a state level, so we have a reduction in time and a narrowing of perspective. Currently, the United States Preventive Services Task Force, the Advisory Committee on Immunization Practices, and the Health Resources and Services Administration come together and say, here's what we recommend you do. This is what is indicated to be best practices. This bill says, nope, we're going to freeze it in time, and then we're going to reduce it, reductio ad absurdum, to a control at the state level. Because everybody knows all good health care decisions come from the insurance commissioner at the state of Colorado. I urge your support of this amendment. It simply says, wait a minute, the bill is a bridge too far. Let's step back. I mean, if this thing's going to pass through here, let's step back, make it a little bit more rational by keeping it in line. It doesn't even require that it be exactly as. It simply says keep it in line with federal recommendations. Colleagues, I urge your support of Amendment L003 to 196.
Senator Frizzell.
Thank you, Mr. Chair. Members, we heard this bill in Health and Human Services, and there wasn't a ton of testimony, but there was some, and there was certainly testimony from the insurance commissioner. Members, I believe that this, and this is just me, I mean, I candidly am the poster child for preventative medicine right here. I mean, I am, and I fully believe in preventative medicine, preventative tests. I think that they're very, very important, life-saving. But I feel that this legislation is a bit premature because it assumes, de facto, that assumes that if guidelines are removed federally, that insurance companies in the state of Colorado would do away with critical preventative medicine. And I just don't see that. I do believe that insurance companies understand the importance and can save them money. So I stand in support of this amendment, and I also want to talk about why this amendment is really important, and that is, you know, I'm really concerned about the insurance commissioner's role in this, and what the insurance commissioner could actually do, what we could see happen, because we're increasing state-level control by giving the Colorado Commissioner of Insurance the authority to adopt rules. And this is someone who is not elected, who I have personally witnessed tipping the scale one way or another on legislation that benefits that commission. So I rise in support of this amendment. I do not believe that the duties, the role of the insurance commissioner should be in any way, shape, or form expanded. And I ask for an aye vote.
Senator Kirkmeyer to the amendment.
Thank you, Mr. Chair. So members, I rise in support of the amendment as well. So looking at the bill summary and listening to the sponsors speak with regard to this bill, you know, at first glance, you're looking at it and you're thinking, okay, it's just to make sure that we're protected regardless of what happens at the federal level if things get repealed, and it would be consistent with whatever has happened as of January 2025. This amendment speaks to a portion of the bill that's on page 2, and it's at the bottom of the page with that little word of additional. So in the bill summary, when it says the bill requires that in the event any of these authorities is repealed, modified, or otherwise no longer in effect, the Commissioner of Insurance may adopt rules to require compliance with the recommendations and comprehensive guidelines regarding the coverage of those preventive services as the recommendations and guidelines that existed in January of 2025. But then when you read through the bill in section 1, it says, but also, the Commissioner may adopt rules as necessary to implement and enforce. Those words are only in cap. So this is additional authority to enforce, including rules that require coverage of additional preventive health care services. So it's going beyond. This is going beyond. This is not just a simple bill that says, hey, everything that was in place as of January 2025, we're going to make sure that all of these provisions that are listed in 18 subparagraph B, subparagraph I, Roman numeral I to 18 B, subparagraph 11 of this section, that part's probably fine. But it's the part here that says additional, and this amendment says, look, if there are going to be additional preventive health care services that are not listed in statute already, that were not already in place as of January 2025, that he can do more rules and add on. Based on what? And now he can add on. And what I find totally amazing is that there's no fiscal note for all these rules that he may add to and enforce. Because again, enforce is new. That's new in the bill. So this amendment says, look, if he's going to add, if the Commissioner of Insurance is going to add additional preventive health services, got to be in line with federal standards. Can't just make stuff up, can't just be adding. I mean, it will increase costs someplace. It may not increase costs to state government, but it will increase costs. Could increase costs to commercial insurance plans. Could increase costs for those folks who are self-employed and have to go out and get their own insurance plans, go get their own insurance. Could increase those costs. I mean, we just saw just this year alone, all the things that have been incurring, all these new rules, things that we've been doing down here in the General Assembly have increased insurance rates to people by 5 to 7%. So this amendment, which I think is a good one, is saying, look, before you do that, we need to make sure that they are in line with federal standards. Before you go enforce some new rule, some new additional coverage of additional preventive health care services, that they should be in line with those federal standards someplace. After all, the first ones were. And we kind of got a feel for it, but I'm wondering what else is left out there, because let me just read to you what is in subsection 18B, Roman numeral 1 through 18B, Roman numeral 11.
Senator Kirkmeyer, how is that related to the amendment?
Because the amendment is saying we should say, thank you, Mr. Chair. The amendment is saying that in the current bill, where it says including rules that require coverage of additional preventive health services not listed in these subsections of this section as recommended by the task force. So, and the amendment says, it would insert on page 3, line 4, strike care and substitute care if those recommendations are in line with federal recommendations. So it is modifying this section of law. And I just want to let you all know what is already listed in law. So I'm trying to figure out what isn't in law that isn't in line with federal recommendations. And I just used 2 negatives in that sentence, so it probably didn't make that much sense. But So we have these sections already in law, and if you're going to do additional coverage and then pass rules to require additional coverage and require enforcement, I would think it should have to at least be in line with federal recommendations, where the first portion, which we have in law right now, which I'm going to read, that it should be in line with federal recommendations, just like everything in sections 18B, Roman numeral 1 through 18B, Roman numeral 11. And we had this discussion to begin with, but it's the coverage must include coverage for the following preventive healthcare services. Now, I'm wondering what's missing. Why do we need additional coverage that aren't in line with federal recommendations? What is missing? What's missing in our statute? What was missing in that federal guidance that came down in the first place that we're trying to freeze in time as of January of 2025? I think it should have to actually be, like this amendment says, in line with federal standards. So it does. We've got like a whole page here in law, and we all know how small our printing is in the statutes, but a whole page here that talks about coverage for the following preventive health services with the A or B recommendations of the task force, recommendations established by the ACIP. And it does go on to speak to unhealthy alcohol use screening for adults, depression screening for adolescents and adults, prenatal maternal counseling for people at risk. The services specified in this section may be provided by a primary care provider. Then it talks about cervical cancer screening, cholesterol screening for lipid disorders, colorectal cancer screening coverage for tests for early detection of cancer and polyps. In addition to covered persons eligible for this, and it goes on a whole nother paragraph about more cancer screening. It also talks about inflammatory bowel disease, Crohn's disease, ulcerative colonitis, or other predisposing factors as determined by the provider. Additional child health supervision services and childhood immunization pursuant to the ACIP, influenza vaccinations, more vaccinations, tobacco use screening, other preventive services, again, as established by the ACIP. Now remember what this amendment is saying. Okay, someone thinks I'm not following or speaking to the amendment. The amendment says if those recommendations are in line with federal recommendations. That's what the amendment says. It adds this into the bill. It would add this into the bill if they're in line with federal recommendations. And then there's a portion of the bill that speaks to that the commissioner may adopt and implement and enforce more screenings, more preventive health services than what's already in statute and what's already been recommended, but more, and require coverage of additional preventive health services. So I started reading some of them. Here's some more. Counseling, prevention and screening for sexually transmitted infection. There's a bunch in here. I won't read all of it. But the division shall implement, it just keeps going on about more coverage. It talks about coverage, and I'm getting all the way through. The section applies to larger employer policies. It just goes on and on. This is what's all in Roman numeral 11. Counseling, prevention, and screening for sexually transmitted. The division shall submit to the Federal Department of Health and Human Services. So in law, we already have this requirement about submittal to the Federal Department of Health and Human Services for determination as to whether the benefit specified in this subsection is in addition to essential health benefits and would be subject to defrayal by the state. So we already put it in law here in one place. We're just asking to make sure that it is insured in this bill, that we put in bill that they need to follow federal guidance, need to follow federal regulations. That's what this amendment is saying. And I think it's extremely important when you read it in relationship to the rest of the bill that says the Division of Insurance So the insurance commissioner could not only adopt rules, make sure we're going to follow all the guidance and guidelines that were there and in place under recommendations from this task force, from the federal government, from federal standards, but that he can also adopt more rules, implement and enforce those, including rules that require coverage of additional preventive health care services. So what this amendment is saying is, it's what I believe the sponsors were saying, is that preventive health services that are in place right now, that are there under federal guidance, that any future rules, preventive health services that are put in place, also have federal guidance and rely upon federal standards. And we're not just going to start adding a bunch of preventive health care services that are beyond, and I don't know what those would be, but that are beyond already in law and already in guidance. So with that, I would ask for an aye vote, just for clarification, if for nothing else, so that we're clear that our standards are in alignment with what's going on at the federal level and federal guidance, as stated by the good sponsors of this bill. And let's make sure that any future preventive health care services that are adopted by the insurance commissioner, that are enforced by him, that are additional coverage, also rely on federal standards and guidance. That's why I asked for an aye vote on L003.
Senator Rich.
Thank you, Mr. Chair, and I'm going to rise again and ask for an aye vote on L003. I want to say to the sponsors that I appreciate what you're trying to do here. I have probably used the healthcare services more than I would like, but it just seems to me that allowing the commissioner just to make rules that are not even included in state law right now, just however he feels like. He is an unelected official, and we all hear 24/7 how upset people are about unelected officials making decisions. So I would ask for an aye vote on L003.
Seeing no further discussion, the motion before Senator Mullica. Senator Judah.
Thank you, Mr. Chair. One thing I want to say here is that we keep talking about the federal level, which is absolutely true. But the point of the bill is to say if the federal level doesn't exist, if these services at the federal level do not exist, then what do we do? And the point, which we also hear a lot, is that the commissioner has too much power. But what the commissioner has to do is essentially say, I need to look to these expert bodies so I understand which recommendations to make. How do we move forward for Colorado? And so the argument of the federal level and the commissioner, we need to take pause on, because again, the whole point of the bill is to say we need to be prepared if at the federal level these do not exist. How do we move forward, and how do we make sure that these preventative services, which are a very long list in statute, continue, and we continue to use these preventative services?
Senator Mullica.
Thank you, Mr. Chair. Interesting position to be in, advocating for smaller government on my side of the aisle and advocating against bigger government on this side of the aisle. And so it's an interesting debate, and really want to thank the good senator from Grand Junction, the good senator from Brighton for this discussion. Don't often like to see the good senator from Brighton having the statute book out, but it is what it is. First, I guess I want to focus on that we already passed one amendment on this bill, Amendment L006, and I want to go back to that because I think it impacts the conversation that we're having. And I agree. I think that we need to make sure that the insurance commissioner doesn't go unchecked. And that's actually what we did here in Amendment L006. And if anyone has it, I would encourage you to pull it out, because The first piece of that amendment specifically says, insurance commissioner, you have to stick to what happened in 2025. Okay, that's what we're requiring you to do. What's going on in 2025? Second section is if you want to go beyond 2025, you need to get permission from InPatch, which is a group that's established here in Colorado of nurses and physicians saying, look, you don't get to do whatever you want. You need to consult and you need to get that permission from InPatch. And so that piece is addressed, I think, from some of the comments that we heard earlier. But I also want to go back to some of the comments we heard, which is saying that that this is going to be stuck, or that we're not going to be able to, that this is, the cart before the horse, essentially. But I think that's our job. I think that's our job, is to make sure that Colorado is prepared for what comes our way, that we're not caught on our heels, and that we are looking down the road to say, hey, if something does happen, that our state's prepared, that the people of Colorado aren't going to have a disruption in the preventative health care that is so important in their lives. And so, again, I would encourage a no vote. I think we've addressed some of the concerns that we've already heard in Amendment L006. And I do think that when we look at L003, it's pushing that back to the federal government. And what the good senator from Aurora and I are trying to do is we're trying to bring that back, smaller government. We're saying, let's talk about Colorado, what works in Colorado. Let's make sure Colorado is protected and we're not going to see any disruption. And so, again, I ask for a no vote on L003.
Senator Kirkmeyer.
Thank you, Mr. Chair. Yeah, and I appreciate those comments, and I thank you, and I appreciate what the bill sponsors are trying to ensure here is that there is preventive health care services that are currently provided, that there wouldn't be any disruption. I don't know, I wouldn't necessarily disagree with any of those, especially after I read through the list of all those preventive health services that are being provided. But here's the other reason why I think there should be in line with Amendment L003, if those recommendations are in line with federal recommendations. Because here's why. When you start reading in the statute books here, which leads me to believe some other things here, but in the statute, under 18B, Roman numeral 11, subparagraph B, capital B, says the divisions shall submit to the Federal Department of Health and Human Services its determination as to whether the benefit specified in this subsection, so if he goes and adds more rules, adds more preventive services, there has to be a determination as to whether the benefit specified, the addition to essential health benefits, and would it be subject to defrayal by the state pursuant to, and it goes through, reads a federal law in place, which I think has to do with our Medicaid reimbursements, with whether or not we get a federal match. And that's my concern. It says the request that the federal department confirm that the division's determination within 60 days after receipt of the division's request and submission of its determination. I think that's our match requirement. That's where we pull down federal dollars to pay for this at the state. So if these new rules, these new services, preventive health services that are adopted and enforced, requiring additional coverage of preventive health services, are not confirmed by the federal government as being something that we can get reimbursed for, that we can pull down matching dollars for, that would be a cost to the state. So maybe this amendment isn't quite right. Maybe we need a different amendment here. But I just want to make sure that whatever rules, because this is going beyond what the good sponsors talked about in their opening sentence. It goes beyond, this bill actually goes beyond what's in the legislative summary, or in the bill summary, which is why you should always read through the bill and not just the summary. And you should always go look at the fiscal note, and that's from a Joint Budget Committee member, because you should always read the fiscal notes. But it's extremely important. We're in a situation in this state where we're in a structural deficit. And we're going to have to be looking at those Medicaid programs that are expansions of Medicaid, that maybe they're pulling down additional dollars or pulling down dollars from the feds that are matching dollars. Some of the programs that have been approved are not pulling down federal dollars, and they're costing us a lot of money. So I think saying that in this amendment, that they need to be in line with federal standards, basically will help reinforce in this. And what I'm saying is, it's the ones that are not the ones that were already there. Those aren't going to be the issue. It's the ones that the commissioner may adopt, implement as necessary, enforce more rules that require coverage of additional preventive health care services. Those need to be in line with federal standards so that we can ensure there's a match, so that we can ensure we pull down those federal dollars. Because it does speak in the law, very specifically in our law, that are subject to deferral by the state. So again, I would ask for an aye vote on L003.
Senator Mullica.
Thank you, Madam Chair, and thank you to the good senator from Brighton. Again, I think this is a great conversation because I think we do need to clarify this bill. Members, I would encourage you to look at the bill, page 2, line 2, section 1. It's in Colorado Revised Statutes 1016-104. That's around commercial insurance. It's not Medicaid. And so this bill doesn't have anything to do with Medicaid, and so I would encourage you to vote no on this because that's not being put at risk with this bill.
Seeing no further discussion, the motion before us is the adoption of L003. All those in favor say aye. Aye. Those opposed, no. No. The noes have it. That amendment is lost. To the bill, Senator Pelton.
Thank you, Mr. Chair. Get that right? You know, our citizens are we're having a hard time making ends meet on all the increased costs of living. Insurance costs is one of them. Not everybody gets insurance provided by their employer. So I find this bill maybe isn't at an opportune time for our state right now. But with that, Mr. Chair, I have an amendment.
There is an amendment at the desk. Will the clerk please read L002?
Amendment L002, amend printed bill page 2.
Thank you, Mr. Chair. I move Amendment L002 to SB 196.
To the amendment.
Thank you. What this amendment does, it eliminates the commissioner's ability to adopt rules as necessary to implement and enforce rules. It aims to reduce that commissioner's power. You know, we talked about some of the powers he has right now, and it seems like our insurance commissioner in Colorado has way more powers than he should, and maybe more powers than about any other unelected official in this state. So with that, I'd urge an aye vote for Amendment L002.
Further discussion? Senator Mullica.
Thank you, Mr. Chair, and thank you to the good senator from Cheyenne Wells for bringing this. And I don't think we actually disagree a lot here in regards to making sure that there is a checks and a balances with the insurance commissioner, making sure that our body and experts have a voice in the policies and whatnot that we're doing and any future policies that are put in place. But again, I'm going to go back to the amendment that we ran at the beginning of this debate, L006, where we did put those checks and balances in, where we do have that if there's any change, that the IMPATCH has to give that permission for that change. And so I'm going to ask for a no vote on L002 because I do think that we've addressed that and still allowed for that flexibility and that ability for our state to be prepared for those changes, but not just putting it purely in the insurance commissioner's hands, making sure that we do have those experts at the table that are guiding that if we go beyond what's happening in 2025 or where we're at the baseline. So I'd ask for a no vote.
Senator, Mr. Minority Leader.
Thank you very much, Mr. Chair. I rise in support of Amendment 2. You've heard of the idea of the wisdom of crowds. The insurance world survives on the law of large numbers, the ability to distill from many, many sources into the best set of practices. This bill seeks to draw things down to a narrow, we're only going to look at what's going on in Colorado from Colorado's perspective. Now, the argument against Amendment 2 is just made that the commissioner doesn't do it all by himself. He also has to talk to this other Colorado-specific board before actions take. This amendment eliminates the commissioner's ability to adopt rules as necessary to implement and enforce rules that require, quote, coverage of additional preventive health care services not listed in subsections 18, et cetera, and 18, et cetera. So what this simply says is the commissioner and the advice he gets from his local cadre of individuals cannot do things beyond what is in the general rules, what is in the general recommended practices as codified by the federal government, by the three different groups. I spoke about them earlier: the United States Preventive Services Task Force, the Advisory Committee on Immunization Practices, and the Health Resources and Services Administration. So kind of this is, I feel like I'm playing poker. You've got the ACE, which is the Insurance Commissioner of Colorado, and you've got an additional queen, we'll call the task force. So you got an ace and a queen, but I'm calling you, I got three kings. I've got three different advisory boards that are saying, and I know here's what we think should happen. And so I'm just playing a little bit of poker with the sponsors here. You got the ace and the queen, but I got three kings. I'm going to win this hand. He's going royal flush on that. He's going to draw an inside straight on his ace. Who knows what's going to happen? All right, let me bring it back to the specific language of the bill, which the chair has been very gracious not to gavel me on my poker analogy. This simply says, if Colorado wants to go off and do things that are quite frankly not seen as advisable by broader medical and insurance authorities, then in fact, you're not allowed to do it. I mean, we're simply creating some restraint that says you got to stay in line with what the broader group is encouraging. That's what Amendment 2 would do. It doesn't restrict beyond what is allowable with the broad advice that's given. It simply says you can't do something more if, in fact, it's not available with the broader advice that has been made available. So I urge your support of Amendment 2.
Seeing no further discussion, the motion before us is the adoption of L002. All those in favor say aye. Aye. Those opposed, no. No. The noes have it. That amendment is lost. Senator Pelton.
Thank you, Mr. Chair. You know, just a minute ago, one of the bill sponsors came up and was talking about, you know, how already with their Amendment 006, the commissioner has to report and go through another board. And so I really appreciated him bringing that up. And with that, I bring another amendment.
There is an amendment at the desk. Will the clerk please read L004?
Amendment L004, amend printed bill, page 2, strike lines.
Thank you, Mr. Chair. I move Amendment L004 to Senate Bill 196.
To the amendment.
Thank you. What this does is it kind of limits the commissioner's authority, but what it does is make it more collaborative. Not only when it comes to repealing or modifying any rules or guidelines, it also has them report to the House and the Senate committees of Health and Human Services and the Joint Budget Committee also to get a whole nother set of eyes, multiple eyes on these decisions. You know, we may not be the experts, but JBC sure knows how it affects the budget, and there's a lot of expertise on these committees also. So I think this is a very good amendment, very common sense amendment that would just get more eyes on the process to make sure that we're not hurting their taxpayers any more than they have to financially, but also optimize their coverage. So I'd ask for support for L004.
Senator Mullica.
Thank you, Mr. Chair, and thank you to the good senator from Cheyenne Wells, and really appreciate this conversation because I definitely think it's starting to come down, this path of bringing it back to the state, which, I think that this area is good when we can bring it back to the state, to that smaller government piece and what works in Colorado. I think the one concern that I have here is when we look at this is that it requires that report to the House of Representatives and the Senate Health and Human Services Committees, which, I chair, obviously, the Senate Health and Human Services Committee, and I think that's a good thing. But I also think we need to have that flexibility, that ability to address if there's something that's happening that's going to hurt or to limit the care that the people of Colorado receive, that we allow for that to be addressed in a more timely fashion, rather than, let's say, this happens when we're outside of session, and then we have to wait to come back into session to be able to have this addressed, and then we have to run legislation. I think that the flexibility is a good thing, and I actually think that benefits the people of Colorado, and I think it benefits our patients that they're not waiting for us to be in session if their access is being hurt or is being limited. And so would ask for a no vote on L004.
Senator Pelton.
Thank you, Mr. Chair, and I appreciate that feedback. We have SMART Act hearings in every committee when we start session, and a lot of these decisions being made, they're not life and death. They're about what could be covered in insurance policies and stuff going forward. So I think it only appropriate that we would pass 004 to let the legislature weigh in also.
Senator Judah.
Thank you, Mr. Chair. Members, I also ask for a no vote because it is important to remember that the recommendations don't affect the budget, which is mentioned in this amendment. So again, I recommend a no vote.
Any further discussion on L004? Senator Callan.
Thank you, Mr. Chair. One of the things sitting there this morning, with the number of new things that are on our horizon in regards to new diseases and or treatments, those kind of things that are out there on the horizon, just outside that door right now, it seems like we're setting this bill up to be able to automatically just put them under the coverage of the people here in the state of Colorado. I think we should probably take a good hard look at Amendment 4 and say, yes, this is a good amendment. Please vote yes.
Seeing no further discussion, the motion before us is the adoption of L004. All those in favor say aye. Aye. Those opposed, no. No. The noes have it. That amendment is lost. Seeing no further discussion, the motion before us is the adoption of Senate Bill 196. All those in favor? You are not in the well, Mr. Minority Leader. Go ahead.
I appreciate the alacrity with which the chair was seeking to move through the proceedings. Thank you for the recognition, Mr. Chair. I will be out of my chair more quickly in the future. So, there are a number of arguments against this bill. You've heard several of them previously. I want to restate one and add 2 or 3 more, but I want to focus at the end of my comments on the potential cost increases for consumers in Colorado. This has been a recurring theme. Bill after bill, idea after idea, we get aspirational, hopeful, well-intended, I would argue frequently ill-considered policies that make life more expensive in Colorado. Enough! Let's stop already. This particular bill, I believe, has its inside the policy space it seeks to address some fatal flaws. It locks in preventive care guidelines as they existed in January 2025. The policy risks stifling updates or advancements in medical science unless we figure them out in Colorado or read about them here and choose to add them. It isolates us and takes us out of the network of 50 states, and quite frankly, beyond that, the international interaction on what healthcare looks like in the moment. If federal recommendations are repealed or modified due to new evidence or better alternatives, Colorado would remain tied to potentially outdated standards unless the commissioner actively updates them. The commissioner's got plenty on his currently, or her in the future potentially, plate. And adding one more thing, be aware of all medical advances as you're addressing your insurance-related job, is a bridge too far, and it would reduce, in my mind, therefore, flexibility and innovation. It creates an over-reliance, my perspective, my argument, on rulemaking. The bill shifts significant authority to the unelected Commissioner of Insurance, already incredibly powerful, arguably overly powerful, allowing that individual to define mandatory coverage through rules rather than this very type of conversation we're having here. One of the amendments offered said, refer it back to House Health and Human Services, refer it back to Senate Health and Human Services, figure out where the elected people of Colorado, or the people elected by the people of Colorado, think that this should go. Instead, this bill says, let's take a snapshot, freeze it in time, and then hand it off to the insurance commissioner. There are undoubtedly, and I think probably, no, although the argument has not been made, I would say somebody should consider, one of the legal minds in the room, should consider potential conflict between federal and state law and how this might play. But there will be, regardless of whether somebody wants to make a constitutional challenge to the law, there will be conflicts and challenges in the enforcement of this bill. The bill's language is vague about how the commissioner should prioritize and reconcile conflicting recommendations. For instance, it says freeze things in 2025, and then consider, if you will, what the Nurse Physician Advisory Task Force says. But it doesn't say how to reconcile those. This ambiguity will lead undoubtedly to legal disputes, uneven enforcement, or confusion among insurers, healthcare providers, and consumers. What ends up being provided in the next round of policies by private insurance carriers? We don't know. We're still waiting for the insurance commissioner to figure out how to reconcile the change from what federal recommendations exist, what's in Colorado statute already, and what's being considered now by the Nurse Physician Advisory Board. And I've sat in, I've never served directly on a Health and Human Services Committee, but I've had opportunities where I was subbed in due to an illness or an absence. And what those arguments that I heard in the times I was in committee, that we really need to have this broad understanding, because medical issues don't stop at the state border, state line. Countries have borders. Some countries have borders. States have state lines. They don't actually have borders. But the medical issues don't stop at the state line. They, in fact, need to be considered across communities that spread across multiple states, in fact, across the country and around the world. If federal guidelines evolve or are replaced with something more effective, Colorado could end up out of sync with national healthcare standards. And we all remember going through some scary times where we didn't completely understand what was going on, and we were not out of step already. What would it have been like if we were out of step and then the step changed again and we fell further behind? But to my primary argument, as I said I would make against this bill, that this potentially is going to increase costs, make life less affordable for the people of Colorado. And that is a theme that we all committed to be attentive to, and I am arguing it is sufficient evidence and sufficient argument to be opposed to Senate Bill 196. And that is, if we mandate coverage based on its static or create expansive guidelines, especially if the commissioner uses this authority that he's given or she's given, that is broad to create new elements of coverage, could fundamentally drive up insurance premiums, could make the already hardly affordable, if you can actually afford it, insurance coverages we have on our health now even more expensive. Preventive care is very often cost-effective. I think we all are in agreement about that. That is something where we have no dispute. But requiring coverage for services that may lose federal backing or lack broad consensus could impose unnecessary financial burdens on insurers, ultimately the policymakers, and then beyond that, we, the policyholders. So this is, I think, a likely cost increase for the people of Colorado, and hence my opposition. I think that argument, that final argument, is sufficient to be a no vote on 196. I will be, and I encourage you to consider that carefully as well. Thank you, Mr. Chair. I do appreciate the additional space to get into the well. Thank you.
Seeing no further discussion, the motion before us is the adoption of Senate Bill 196. All those in favor say aye. Aye. Those opposed, no. No. The ayes have it, and Senate Bill 196 is adopted. Will the clerk please read the title to Senate Bill 205?
Senate Bill 205 by Senator Hendrickson and Representative Espinosa concerning a firearm serial number check and in connection therewith, creating a standardized procedure for a federal firearms licensee to request a firearm serial number check and imposing a penalty under certain circumstances if a licensee does not file a report with law enforcement.
Senator Hendrickson.
Thank you, Mr. Chair. I move Senate Bill 205 and the State Veterans and Military Affairs Committee report.
To the committee report.
Thank you, Mr. Chair. In the SVMA, we adopted 2 amendments. The first amendment states that it is not just the responsibility of sheriff's departments to conduct the serial number checks if the FFL dealership is located in city limits, that would be the police department. And in the second amendment, we specified that if the federal government promulgates rules allowing for direct NICS and state-level searches of serial number lists of stolen and missing firearms, and that infrastructure becomes available, that federal or that FFL licensed dealerships in the state of Colorado could use that list to fulfill the provisions of this bill. So again, I ask for an aye vote on the committee report from SVMA.
Is there any further discussion on the committee report? Seeing none, the motion before us is the adoption of the State Veterans and Military Affairs Committee report. All those in favor say aye. Those opposed, no. The ayes have it, and the committee report is adopted. To the bill, Senator Hendrickson.
Thank you, Mr. Chair. Senate Bill 205 comes to me from an idea from a couple of gun dealerships in my district who are concerned and a little nervous about transactions that deal with used firearms. Sometimes it's an individual that wants to sell a used firearm to the dealership. Sometimes it's a proposed trade-in. You want a new firearm, you have an old firearm, and you want to trade up. But there is some concern around stolen firearms or missing firearms. Right now, there is no restriction that would require a gun dealership to check when they're taking a firearm on a sale from a private seller or as a trade-in to see if that firearm is stolen. And this bill doesn't change that. But there's some nervousness around that because if you pay for somebody's firearm or a firearm that somebody brings you and it turns out that that's not actually their firearm, that it's a stolen firearm, if you then sell that firearm or you figure out before you resell that firearm that it's stolen, you eat the cost of that. And that is a potential extraordinary cost of doing business that nobody wants, obviously. Pawn shops in the state of Colorado have a way to avoid this risk. Any serialized item that is brought to a pawn shop stays on their inventory for 30 days before being offered for resale, and we have statutes that guarantee that during that 30-day period, any serialized or VIN identified item can be or shall be checked by law enforcement to see if that has been reported stolen. When law enforcement gets back to the pawn broker and says that an item is stolen, they can withhold the money from going out to the person who brought them that item, and they do not lose in this exchange. There's no such provision that exists for traditional FFL dealerships. But now we have a 3-day waiting period in Colorado. And so the ask from my dealerships was, hey, what if we can use this 3-day period to ensure that we can have that same protection? And to be clear, some have, on some occasions, in a little bit of a haphazard way, get this protection, because I have dealerships now that when somebody brings in a firearm for sale or trade, they'll call both of these dealerships are in the county, so they'll call the sheriff's department, and the sheriff's department will respond with either, yeah, I've got somebody available, we're happy to check that for you, and they'll come over and they'll check the serial number, they'll cross-reference CBI data and the NICS system and say, yeah, all checks out good, not stolen, not missing, go ahead, proceed with the sale. But it doesn't always work that way. Sometimes the response is, hey, all of our deputies in the field are really busy, nobody can get to you right now, maybe try back tomorrow, where there's also no guarantee. And then that person is taking their business to a pawn shop, or they're taking it online, or they're taking it to another form of private sale, sometimes in a transaction that isn't actually legal. So what this bill seeks to do before us is to create a framework where traditional firearm dealerships can have more confidence that the firearms that they're taking in are done in a legitimate transaction, gives firearms owners a guaranteed avenue to sell or trade in their firearms in a secure and legal framework, gives consumers more security that the firearms that they're purchasing are legitimate firearms that have gone through legal processes and legal chains of custody, and provides an opportunity for better cooperation between FFL dealerships and law enforcement when there is identification of a potentially lost or stolen firearm. Nothing in this bill is mandatory on the FFL dealerships. It's simply an option that creates more safety for everybody involved in the transaction process, and I ask for an aye vote on Senate Bill 205.
Senator Pelton.
Thank you, Mr. Chair. So, I heard this bill in committee. I appreciate what the sponsor's trying to do. My concern, again, is with the sheriff's office and the sheriff's office capacity. I have several pawn shops in my district and that we're talking about here. And if you look on page 3, and it goes in with what the sheriff's office has to do, what the sheriff's office shall begin providing firearm serial number checks no later than July 1st, 2026. I had to wait, a little while to get, when I bought a trailer, to get a VIN number inspection because my sheriff is busy doing other stuff. So I think that allowing some flexibility with the sheriff's office would not be an unreasonable request. So I'm going to ask for a couple of amendments here. One of them is on page 3, section B, lines 16 through 21, to instead convey that the failure to make a report as required within a reasonable time period after the dealer reasonable believes, knows, or should know, or become aware of the firearm being stolen, lost, or involved in an open criminal investigation is subject to the penalties described. That's what's going to lead into my First Amendment.
There is an amendment at the desk. Will the clerk please read L005?
Amendment
Senator
L005.
Pelton.
Thank you, Mr. Chair. I move L005 to SB 205.
To the amendment.
Thank you, Mr. Chair. This amendment promotes fairness by maintaining the requirement for the sheriff's office to submit a report upon becoming aware of the stolen, lost, or criminally involved firearm. However, it grants the sheriff's office the discretion to determine the appropriate timing for such reporting, thereby allowing them to prioritize this matter based on departmental capacity and caseload. So I ask for an aye vote on L005.
Senator Henriksen.
Thank you, Mr. Chair. I respectfully ask for a no vote on L005. One of the reasons that we specifically tailored the time frame that's in the bill is because we now have a 3-day waiting period in Colorado. This is something that I actually voted no on. This is something that the dealerships I've worked with in my district were opposed to, but they've come to me and said, well, since we've got this, we actually have this opportunity where we could take in a gun on trade-in or on exchange, and the money doesn't have to go out because we're not processing the new firearm sale in 3 days anyway. We can't do that. So if we're going to have that time frame, then we could have a little bit of a buffer to get an answer on this when law enforcement isn't able to immediately respond, and then we can still proceed with the exchange of money once the 3-day waiting period clears. We have the full background check through the NICS system, and we're able to facilitate that exchange within that framework that now exists in current law. So for that reason, I ask for a no vote on L005.
Senator Pelton.
Thank you, Mr. Chair. As somebody who has been in charge of the sheriff's budget in a county, I think that I'm trying to just prevent an unfunded mandate, just for the sheriff to have to come to me to make me require another full-time employee. And I think that that's what we're trying to do here, where it grants the sheriff's office the discretion to determine the appropriate timing for such reporting, thereby allowing them to prioritize this matter based on departmental capacity and caseload. Some of our rural areas don't have a lot of FTE when it comes to sheriff's office. I think that that's what we're asking for, is to make sure that we're not overburdening the counties where these are. So I'm just sitting here going, I just want to prevent an unfunded mandate with this amendment, and I ask for an aye vote on L005.
Senator Pelton, R.
Thank you, Mr. Chair. I too support L005. My home community, home county, right now we are currently 2 deputies short in a 5-officer department. Our business office is only open from 8 to 5. The rest of the time we contract with a neighboring county. Our dispatch is contracted through a neighboring county just because we do not have the personnel to keep our office staffed. So this could put an extra burden on our sheriff's department, and so I urge support for L005.
Seeing no further discussion, the motion before us is the adoption of L005. All those in favor say aye. Aye. Those opposed, no. The noes have it. That amendment is lost. Senator Pelton.
Okay, thank you, Mr. Chair. We'll try another amendment on the same, in the same area of the bill.
There is an amendment at the desk. Will the clerk please read L006?
Amendment L006, amend the state.
Thank you. Thank you, Mr. Chair. I move L006 to SB 205.
To the amendment.
Thank you, Mr. Chair. We're in the same part of the bill. What this amendment does is it strikes a balance between accountability and practicality by preserving the reporting requirements for the sheriff's office while extending the time frame to 72 hours, allowing more flexibility to manage competing priorities within the department. Again, we're just trying to prevent an unfunded mandate in these counties and with the sheriff's departments. That's all we're trying to do. Just giving them a little bit more time and flexibility and asking for 72 hours. So I ask for an aye vote on L006.
Senator Hendrickson.
Thank you, Mr. Chair. One of the provisions that we have in the bill already is actually the 72 hours for the responsiveness of the, between when the serial number is called in and when the post-certified law enforcement agency responds to the dealership. And that's what's actually the keeping with ensuring that the answer gets back and that they're able to make a determination on the exchange itself. That is further down in the bill, so I would ask respectfully for a no vote on L006.
Senator Pelton R.
Thank you, Mr. Chair. I rise in support of L006. You know, I was up here just a minute ago talking about how shorthanded my home county sheriff's department is. There are no police departments in my county, and several of my counties in my district, out of the 13, several of them are having the same issue, being shorthanded and stuff. So this amendment, adding another 24 hours, I think would be very helpful to get it done without having to maybe hire a third-party contract, which, you know, that just adds to the expense in our small counties where we already have a hard time making budget. So I think this would be a good amendment to try to alleviate the possibility of an unfunded mandate and give them just 24 hours more to comply. So I'm in full support of L006.
Senator Hendrickson.
Thank you, Mr. Chair. And upon reading this a little bit more closely, I have a concern because what we're actually dealing with is the reporting period once an FFL realizes or has reason to believe that a firearm is actually stolen, and it's the time period with which they report that back to law enforcement. And that's whether they're able to do the check themselves, hopefully soon, with their own ability to cross-reference versus the CBI and NICS system, or through reporting from the local law enforcement agency. There's a provision that if you do go through the confirmation process of verification of the serial number, and you find out that you have reason to believe that the firearm in your possession or that was brought into your store is a stolen firearm, that you have to report that. And that's what this is amending, and that's a deviation from what exists in the language for what's already required for pawnbrokers. So again, I ask for a no vote on L006.
Seeing no further discussion, the motion before us is the adoption of L006. All those in favor say aye. Aye. Those opposed, no. No. The noes have it. That amendment is lost. Senator Pelton.
Thank you, Mr. Chair. So we're in the same part of the bill, exact same part of the bill, and we're going to ask for another amendment.
There is an amendment at the desk. Will the clerk please read L007?
Amendment L007.
Senator
amendment.
Pelton.
Thank you, Mr. Chair. I move L007 to SB 205.
To the amendment.
What this amendment does is it maintains the reporting requirement while introducing a practical safeguard that considers potential extenuating circumstances, offering law enforcement fair and flexible timeline without compromising public safety or departmental discretion. If there happens to be a major crime investigation, such as a kidnapping of a child or serial killer at large, the sheriff's office will not be penalized for prioritizing those cases for the time being if it is a all-hands-on-deck situation. Again, what we're trying to prevent here is putting the sheriff's office in a compromised situation, and we're trying to make sure that they have complete discretion over what they prioritize when it comes down to this or another incident that's going on in the sheriff's office. So I ask for an aye vote on L007.
Senator Hendrickson.
Thank you, Mr. Chair. Yeah, I have concerns with the policy aforementioned by the good senator from Sterling, but once again, we're actually in the section that deals with the FFL reporting back once they find out or have reason to believe that the firearm in their possession is stolen. And I'm struggling to come up with an extenuating circumstances where you wouldn't report that back in an immediate manner to the law enforcement entity that has jurisdiction over this. So again, I ask for a no vote on L007.
Senator Pelton.
Thank you, Mr. Chair. I'll give you a great example. If this law was in place in 2017, when we had a fire, all hands on deck were at the fire. That's what it was. Everybody, all the sheriff's deputies, the sheriff, the fire department, police department, were all at the fire that burned 32,000 acres in Logan and Phillips County. That's an extenuating circumstances. But instead, you got to pull one of those deputies off to go check this serial number. That's what you got to do. So what we're asking for is just some more time, some more flexibility for the sheriff's department to say, we're going to prioritize this, then we're going to go to that. That's what we're asking for. With this amendment, L007, we're asking for a little bit of flexibility. That's what with all three of these amendments that I've ran, I said this in committee, I'm a little concerned with the burden that you're putting on the sheriff's department on where he has to prioritize or where he has to look at. So yes, that's an example. I can give that example because I lived through it. I dealt with it. We had a gentleman out in the middle of the Eastern Plains who decided to weld on his feed bunk in 97-mile-an-hour winds. That's what started the fire. And that's what burned 32,000 acres throughout the state, or throughout my two counties, Phillips and Logan County. Do you know what stopped it? We turned on the irrigation pumps in Holyoke, and that's what stopped it. That's what slowed it down. That and the winds died down a little bit. But 70 or 97-mile-an-hour wind gusts were blowing that fire. Every deputy, we were trying to get people out of their homes, out of the way of the fire, everything, and that's what they were doing. That's what I'm talking about with prioritizing. So I ask for an aye vote on L007.
Senator Hendrickson.
Thank you, Mr. Chair, and thank you again to the good senator from Sterling. I guess we're talking about two different things here and two different sections of the bill that we're actually amending. I appreciate the example given. I think if we had an amendment that were to speak to that, I still have concerns, and I would be happy to speak to that. But I want to be clear here that what we're talking about is there's a section in the bill that right now reads as follows. Failure to make the report as required by this subsection within 48 hours after the dealer reasonably believes, knows, or should know, or becomes aware of the firearm being stolen, lost, or involved in an open criminal investigation is subject to the penalties described under section 1812-401.5. Paragraph 7. We're not talking about the section that deals with the law enforcement agency performing the serial number check. We're dealing with the section that deals with a FFL dealer now has the realization of, oh, shoot, I think I have a stolen firearm on my hands. What do I do? Well, the requirement under law for pawn shops, and would apply here, is within 48 hours, you report that to the pertinent law enforcement agency. And we're now, with this amendment, we'd be changing that from 48 hours to 48 hours or a reasonable time period if there are extenuating circumstances. Not That's not natural disaster related at all. This is dealing with the realization that you probably have a stolen firearm on your hand. So, want to give that clarification, ask for a no vote on L7.
Seeing no further discussion, a division has been requested. We will be in a senatorial 5. Ready? All right, a division has been requested. All those in the chamber not entitled to vote, please be seated. The motion before us is the adoption of Amendment L007. All those in favor, please stand. Please be seated. All those opposed, please stand. The chair is not in doubt. L007 is lost. Senator Pelton.
Thank you, Mr. Chair. You know, it's kind of disappointing some of these other amendments haven't got put on, but with that, I have an amendment.
There is an amendment at the desk.
Thank you.
Will the clerk please read L008?
Amendment L008, amend the printed
Senator
bill.
Pelton.
Thank you, Mr. Chair. What this amendment does is, in the bill, it authorizes CBI to investigate illegal activities involving firearms statewide, and it also appropriates $1.477 million from the general fund to the Department of Public Safety to do this. What this amendment does would reimburse county sheriffs and police departments for these serial number checks. And I think that would just be very appropriate to not put them in a budget shortfall. So with that, I'd urge support for 008.
Senator Hendrickson.
Thank you. Mr. Chair, I ask for a no vote on L008. Right now in the bill, we have a provision that a law enforcement agency with jurisdiction over the FFL dealership who performs these checks cannot charge more than what it actually costs to the department to do the check itself. So we're talking about a very, very nominal fee. It is permissive. Law enforcement agencies do not have to charge the fee. We've heard from several saying that they would not charge a fee were this to be in effect. And one of the reasons that we have that is because of the 3-day turnaround period that this bill would guarantee of that check being performed in, and that the FFL dealership would get a response to. To take that funding out of the funds created through Senate Bill 25003 would not be an appropriate use of those funds, and I ask for a no vote on L008.
Seeing no further discussion, the motion before us is the adoption of L008. All those in favor say aye. Those opposed, no. The noes have it. That amendment is lost. Senator Pelton.
Thank you, Mr. Chair. I have another amendment.
There is an amendment at the desk. Will the clerk please read L009?
Amendment L009, amend printed bills.
Senator
Strike.
Pelton.
Thank you. You know, I move amendment L009.
To the amendment.
Thank you. What this amendment does eliminates the ability for the sheriff's office to charge any fees to FFLs for background checks. You know, public safety shouldn't come with a price tag. So placing a fee on that process only discourages compliance and cooperation. If we want to get rid of illegal guns off the street, we need to make it easier, not harder, for the FFLs to do the right thing. So with that, I urge support for 009.
Senator Hendrickson.
Thank you, Mr. Chair. I ask for a no vote on L009. We had a lengthy discussion on this part of the bill in committee, and I've had several conversations both before and after committee on this part of the bill. Again, I think we've struck the language right where a law enforcement agency can only charge the cost of doing that check, that the time associated with doing that check, which is going to be very minimal and would be a nominal fee at that. Certainly there are some dealers that would like for there to not be able to be a fee associated at all. Law enforcement has come back, said that they feel that if this is going to be a requirement on them, that they want to be able to ensure that they're able to pursue that if that is the choice of the local law enforcement entity. The dealerships, I've had extensive conversations with them this weekend, the dealerships that brought this bill idea to me, they're fine with the language as it is. I think that the fee language in the bill is appropriate and strikes the balance that we're looking for. Ask for a no vote on L009.
Seeing no further discussion, the motion before us is the adoption of L009. All those in favor say aye. Aye. Those opposed, no. The ayes have it. That amendment is lost. Seeing no further discussion, the motion before us is the adoption of Senate Bill 205. All those in favor say aye. Aye. Those opposed, no. The ayes have it. That bill is adopted. Will the clerk please read the title to House Bill 1011?
House Bill 1011 by Representatives Garcia and Sirota and Senators Kipp and Judah concerning requirements for child care centers owned by an institutional investment entity.
Senator Kipp.
Thank you, Mr. Chair. I move HB 251011 and the committee report, and I respectfully ask for a no vote on the committee report.
Any discussion on the committee report? Senator Kipp.
Yeah, so at the time the amendments in committee got onto the report, we said we would continue to look at the amendments to ensure they were under the title. The amendments do not fall under the title of the bill, and we feel they need to not be adopted. So we ask for a no vote on the committee report.
Further discussion of the Business, Labor, and Technology Committee report. Mr. Minority Leader.
Thank you very much, Mr. Chair. Colleagues, I'm going to spend a little bit of time talking about this because it's meaningful. The committee report is an acknowledgement and a protection of all Colorado children, all child care centers. It sought to provide a compromise for the benefit of all. And to fail to put the committee report onto the bill as it was heard by the people, testified to by the people, and decided by the committee is in fact a mistake. Now you're going to hear a red herring argument. You've already heard a little bit of a foreshadowing of it. You're going to hear the argument, well, it doesn't fit under, the committee report doesn't fit under the title of the bill. I'm sorry, I shouldn't be chuckling about that. The reality is, if you were going to argue that, it should have been argued in committee. In fact, it's fatuous to argue it now. The compromise adopted in the committee, colleagues, keeps the consumer and worker transparency protections that HB 1011 proposed as introduced in place. The merits of the policy proposal still remain. The compromise made in committee simply expands the bill to apply to all child care centers, bringing those protections to all Coloradans. That seems to me to be an easy thing to ask for and answer with, and it is exactly what the committee determined should happen. This bill, without the amendment adopted in the committee, is a missed opportunity to do real good for all families and all child care workers. If the guardrails are worth putting in place for a few, the guardrails should be in place for all. So I urge that you accept the committee report. And as I heard the framing, the sponsors requested that the committee report would be rejected. I urge for a no vote on the rejection of the committee vote, and I vote on the acceptance of the committee vote. So listen carefully to the motion. The committee report must remain in the bill.
Further discussion on the committee report? Seeing none, the motion before us is the adoption of the Business, Labor, and Technology Committee report. All those in favor say aye.
Aye.
Those opposed, no. No. The noes have it, and the committee report is rejected. Is lost. To the bill, House Bill 1011. Senator Kipp.
Thank you, Mr. Chair. Colleagues, Colorado is the fifth most expensive state for child care in the entire country. In Colorado, we have a shortage of 75,000 licensed child care spots. Private equity loves buying things with inelastic demand, according to Stephen Billings from the University of Colorado Leeds School of Business. People need to have it. They're willing to pay a lot for it. Child care is something people must have or they're not going to work. About 7.5% of Colorado's total licensed child care capacity is owned by private equity, and this number is increasing. These are institutions with major profit motives who fully own and operate these programs. This is a company saying, I'm going to buy you, and I'm going to own you for 3 to 7 years to get as much money as possible out of you, and then I'm going to sell you to somebody else. That is what is going on. Understaffing, lower quality of care, and general disinvestment are common under private equity ownership in all kinds of service industries. The risk of consolidation under private equity can result in daycare deserts, putting child care even further out of reach in low-income areas. In committee, we heard from child care providers about all the great things they do in caring for their kids and employees, and that's wonderful. There is nothing in this bill that stops any of these providers from doing anything they are already doing. Colorado already has different regulations and oversight depending on provider type. We treat family child care homes differently than large centers and differently than school-based providers. We have nuanced regulations based on resources and structure. That is what this bill does. Let's be clear, these child care dollars accept and use public dollars. Child care centers accept and use public dollars in order to help provide this public good. This bill asks for minimal transparency from these larger child care operators as a guardrail to protect consumers and employees of child care centers owned by private equity, and to protect our public dollars which are used by these child care centers. I ask for a yes vote on House Bill 1011.
Senator Judah.
Thank you, Mr. Chair. Members, listen, I want to say this, but I want to say it correctly. There is a huge misconception that this industry is competitive. I want to say that again. It's a misconception that this industry is competitive. But competitive means that there are too many centers and not enough families, meaning they are trying to get parents to come to their centers. But the reality is that we don't have enough licensed child care spots to meet the needs of all children who are seeking child care today. Parents are desperate to find care and have zero negotiating power when parents have to make the decision based on simply availability and not affordability, quality, or what is best for their families. Demand is simply higher than supply. This is why the original bill did not include all centers. We did not want to include the mom and pop centers. And that's what we heard in committee. That was actually one of the concerns, was the mom and pop centers. We are addressing a very specific business model. Licensing accounts for different models include home-based, large and small centers. Addressing the way private equity engages in early childhood is imperative to ensure our child care sector does not face the same fate that nursing homes, healthcare, veterinarians, and prisons face. I want to humanize this for you a little bit. We all know we don't make a lot of money, $45,000, $42,000 a year is pennies. It's not a livable wage. My daughter's child care is half my salary. Half my salary. If I was a single parent or a single income household, there is no way I would be able to survive if I wanted her into safe, quality, sustainable child care. Half my salary. Please keep that into consideration. Keep that in your mind when we talk about how we want to protect our children. Is the bottom line, in fact, the bottom line for opposition? Or is it, in fact, making sure that families can afford child care that they can depend on and feel safe sending their children to? With that, I ask for an aye vote.
Senator Kipp.
I just want to reiterate, this bill does two things. If you are a private equity provider of child care, you have to put your prices on your website, and you have to give people notice, 60 days notice, if you're going to cancel their child care or change staffing because of the takeover of that child care. That is it. This bill does not do a whole lot, but it puts on minimal guardrails. We ask for a yes vote. Thank you.
Further discussion of the bill. Senator Bright.
Thank you, Mr. Chair. And thank you to the bill sponsors for addressing such an important topic that affects families every day in Colorado. This is my world. This is the world that I live in. This is something that I'm proud, a service that I'm proud to provide to families in northern Colorado. And we do it the best that we can, and we do it as efficiently as we can. And I can tell you that this industry is not overpriced for the level of regulations that it has to comply with. It's absolutely priced fairly for what we have to deal with as an organization that has to comply with a laundry list of things that I think those regulations that address safety are incredibly important. I feel like they should be there. But when it goes over the top and it addresses things that don't have anything to do with childcare, then that's when childcare gets expensive. This bill, House Bill 251011, I promise you, will reduce childcare supply and will increase childcare costs. Guarantee it. I've seen it every single time, and I've been in this business for 35 years. There's a assumption out there that we're out here to get rich. And I can tell you that my company, my childcare company, has 2 weeks of cash on hand. 2 weeks. Do you guys have more than 2 weeks of cash on hand for your business or your life? Probably so. Childcare companies are on the edge, and it's only because of the business acumen that we've been able to survive this company for 50 plus years. I come from a background, an education background of business, accounting. And I can tell you that this business that I have wouldn't exist if I didn't have that background in business. 90+% of childcare owners have a passion for kids and for early childhood education. And that's why they get in the business, and I love them for that. What they need desperately is some business training. They need a business background so that they can know how to pay their bills and how to pay payroll and how to make it through this month and how to generate at least 2 weeks of cash on hand. I have 25 child care licensed programs. Some are small, some are big. Not one of them has more than 60% full. Not one of them is more than 60% full right now. There is all kinds of supply out there. The bill as provided addresses 2 things. Number one, it addresses a transparency of prices. Number 2, it addresses a 60-day waiting list or waiting period, notification period if you're going to change staff based on change of ownership. We discussed a bill last week that addressed dyslexia screening. That screening is in addition to a base level general education screening that has 38 points in it. Every 3- and 4-year-old in the state of Colorado has different needs to become school ready. The basic assessment tool has 38 points on it. One child may suffer in 3 or 4 areas over here. Another child may suffer in 2 or 3 areas over here. Another child may have issues that have longer lists. The idea behind individualized screening for every child is to make sure that every child is ready for school. To address those points that each child, that Johnny, that Susie, that Mary are missing to get them ready for school. Do you think there's one price tag that covers all of those things? So not only does each child have different needs, but each parent has a different working system. They have different work situations. You have single parents out there, you have dual parents out there. Some of them match their schedules up. Some of them are a firefighter. One works at EMT, another one's a real estate agent. And so mom works Monday, Tuesday, Wednesday. Dad works Thursday, Friday, Saturday, so that they can mix and match their work schedules to minimize their childcare costs. Sometimes they want their child to go in for preschool in the morning. Sometimes they want their child to go in preschool in the afternoon. Sometimes they want full days on Mondays and Wednesdays. Sometimes they want full days on Tuesdays, Thursdays, and Fridays. Sometimes they both have to work. Some weeks they don't have to work, and they want to stay home with their child. And I've always maintained the best place for a child is to be at home with their parent. And if that's not possible, the second best place for a child to be is in one of our centers that Colorado has championed as high quality. I think we've done some awesome things to make Colorado a better place for kids and to offer high quality early childhood education options for families. And so what do you think the published rate sheet looks like? If I'm gonna put all of those rate combinations, maybe we've got 2 hours on a Monday and 6 hours on a Wednesday. Maybe we've got Monday, Wednesday, Friday full time, and Tuesdays and Thursdays are off. What if I have after hours? I have later care that happens in the evenings because we have a parent that works in the ER. What does that rate look like? What do you think my rate sheet looks like when I go to be in compliance with House Bill 1011? Specifically saying that I have to maintain an accurate fee schedule on my website. How confusing do you think that's going to be for families? I want to talk to those families. I want them to come in and say, tell me about Johnny, tell me about Susie, tell me what you need. Tell me about what you're struggling at home. Tell me what they do well, and let me help you find the best solution for Johnny, for Susie. Maybe Mondays through Fridays are gonna work great for the next month, and maybe they have custodial issues where that doesn't work. How do I put that on a website? How do I print that and put that on a sheet and say, here's your rate sheet, figure it out? With that, I have an amendment.
There is an amendment at the desk. Will the clerk please read L016?
Amendment L016, amend business, labor, and
Senator Bright.
technology.
Thank you, Mr. Chair. I move amendment L016 to House Bill 1011.
To the amendment.
The amendment discusses transparency and accountability to families, and it adjusts the requirements for child care centers. I believe that interaction, that personalized, face-to-face discussion of needs and the rate that's associated with that need, because not all rates are the same. If I told you that I was going to charge you $400 a week for your child care, and it didn't matter how many days you showed up, it didn't matter how many mornings, how many afternoons, it didn't matter what sort of extra services that you needed, it doesn't matter whether school district staff are going to come in and provide IEP services, it didn't matter any of that. It's just $400 a week. I don't think you would choose me, and I think that would be a mistake. And I think that families deserve choices. With that, I ask for your aye vote on Amendment L16.
We are going to stand in a brief senatorial 5.
All right, we're back. Senator Bright.
Thank you, Mr. Chair. I move to withdraw Amendment L16.
L16 has been withdrawn.
Thank you, Mr. Chair. In its place, I would move Amendment L17.
There is an amendment at the desk. Will the clerk please read L17?
Amendment L17, amend the re-engrossed
Senator
bill, page
Bright.
4.
Thank you, Mr. Chair. Amendment L17, and I'll just read it so that we know what it is. For transparency and accountability to families, the Child Care Center shall maintain an accurate fee schedule on the Child Care Center's website. If the Child Care Center updates the fee schedule, the Child Care Center must update the fees schedule posted on the Child Care Center website to reflect the new fee schedule within 3 business days. Child Care Center must provide a hard copy of the fee schedule to anyone who does not have internet access, and this is in context of that face-to-face meeting. If a family or individual inquires about the Child Care Center fees, the Child Care Center must direct the family to the website, provide them with information, or if the family does not have adequate internet access, a hard copy will be provided. I move L17 to House Bill 1011.
Further discussion on the amendment? Senator Liston.
Thank you, Mr. Chair. Members, while I rise in support of Amendment L17, I sit on the Business, Labor, and Technology Committee, and I heard this bill and listened to it as thoroughly as I possibly could. Let me go over a few things that might create some confusion or some myths about the child care industry. And I don't profess to be an expert, but these are some things that I learned during the committee, is that there's one myth that the child care providers are proliferating, here in Colorado, like they're everywhere. And the truth is, the reality is that the so-called corporate or equity-based child care investor, they only represent 10% or less of the entire child care industry. Well, 10% is small. That means the other 90% are the so-called mom and pops, like the good senator from Weld County, who's an expert. He's an acknowledged expert. That is his profession. He knows what he's talking about. So it's not like the investor-owned are coming in and squeezing out and taking over the world. The reality is they are not. It's only 10% or less. Another myth is that the investor-owned child care centers, that they don't, that their child care facilities are of a lesser quality. That is not true. Studies have shown that by industry standards, that in terms of cleanliness and the staffing and all the measurements that can be used by that these accredited centers, it's called NAEYC. I'm not sure exactly what the AC. I'm sorry, my eyes give me problems sometimes. That is the gold standard of the industry. That these so-called investor-owned, they have the money and the resources to invest in their child care centers. They want to do it, and they do it. They take their profits, and they continually reinvest in it. Nothing against the mom and pops. I'm sure that they want to do it too, but they don't have the resources sometimes that the investor or the corporate-owned, whatever you want to call them, have. I heard a very good example that was said in testimony, and I spoke to the representatives afterwards, to open a child care center just for the land alone, just for the land, and we're not talking acres, we're talking for a plot of land probably that's not much bigger than this room or less. Just for the land alone, it's over $1 million. Over $1 million. Now then, I don't know, but there probably are not very many mom and pop operators that have $1 million that they can put down just for the land alone. Now then, if you want to have a facility, a modern, attractive, competitive facility with all the equipment and the room and the resources, that's going to bring, believe it or not, that's going to bring the cost of a child care center a minimum of $5 million. That's the bare minimum, and they can cost upwards of $7 million. Now then, if you can find a mom and pop that's got spare change of $5 to $7 million for an industry where the profit margin is low, well then more power to you. The other thing is that somehow that the corporate-owned, those evil corporate-owned ones, don't attract the underprivileged kids. That is not true. They are keenly interested in providing the resources for the underprivileged children. They do that consistently, and they do an excellent job at it, and that was continually testified. The other thing that I wanted to speak about that's in Amendment L017, members, colleagues, is that that under this bill, that requires that a 60-day notice be given to all of the parents if there's a reduction in staff or a staff person were to quit or whatever. Otherwise, they could be sued. Well, I don't know of very many businesses or of any that you have to have a 60-day notice that if an employee leaves the facility or they do get laid off, that subjects the business to being sued. Quite frankly, members, if we want to, it's been testified or it's been mentioned by the good sponsors that there is a shortage of facilities here in Colorado. If we pass this piece of legislation as written, that will send a clear signal to the corporate-owned that you're unwanted, you're not welcome here in Colorado. We need to be sending the opposite signal, that we want you to come into Colorado. We want you to invest. We need your resources, that to have a facility of $5 to $7 million that a person or a group of people just don't have the resources to do, that a corporate-owned like KinderCare is one of them that comes to my mind, and I know there's 3 or 4 others, that you have the resources, and we hope that you do come in because that will increase the supply. If we want the costs to go down, members, we need to increase the supply. And if we want to increase the supply, we need to put out the welcome mat to the mom and pops and to anybody and everybody who wants to invest in these expensive facilities. So with that, members, I would encourage and I vote on Amendment L017. It's a fair, it's a well-written amendment, and I urge and I vote on Amendment L017. Thank you, Mr. Chair.
Senator Carson.
Thank you, Mr. Chairman. I also support Amendment L017 offered by our colleague from Platteville. You know, one of the things we should do more of around here is pay attention to people, excuse me, fellow senators, I should say, who have expertise in a particular area. And the senator from Platteville is involved in this business, child care business. He knows this business. He's an entrepreneur in this area. So I think we should pay attention to what he's saying, both on amendments and on the bill. Now, I'm going to speak a little, when we get back to the bill, I have a few comments on the bill, but this amendment, speaking specifically to the amendment, which I think is very reasonable, it says you just got to post your fees there so that the consumers, the families can see what you're charging. We give them some flexibility in this area. I think overall this legislation puzzles me. As I said, I'll talk more on that in a minute, but I want to tie in with this amendment. It puzzles me that we want to regulate more in an area where we want more businesses. If we want more child care, I think we all agree there's a shortage. In fact, the sponsors of the bill have alluded to some numbers of 75,000 shortages, fifth most expensive child care in the country. And so, my reaction to that is, why would we want to restrict a group of investors coming into child care? I would think we'd want more participants of all kinds providing child care in the state. If we regulate it, we restrict it, we put burdensome requirements around posting fees and these type of things, we're going to discourage folks for participating in the business. We're going to make it more complicated. They're going to have to spend more time on rules and regulations and less time actually taking care of the children that are in their care. So I support this amendment. I think it's a reasonable approach, and we'll get some more discussion on the bill here in a few minutes.
Senator Kipp.
Thank you. And I do find myself a little bit confused here, frankly. So let me just tell you how I read this amendment, and maybe the good senator from Platteville can help me clarify. Right now, the language in the bill says, a child care center owned by an institutional investment entity shall post and update child care pricing on the child care center's website pursuant to the requirements of section whatever. And this amendment that is being brought forth seems to me to have much more onerous and specific requirements. And so, forgive me, but I am very confused about why the good senator from Platteville would like more onerous requirements when I don't think he likes it. Now, if the good senator from Platteville if this amendment will move him to a yes on the bill and he likes these more onerous requirements, I'm totally there for it. But I am certainly confused. Perhaps he can help explain.
Senator Bright.
Thank you, Mr. Chair. And thank you to the bill sponsors for bringing that up. Amendment L17 just gets a little bit more specific about what is required. I feel like the vague language in the bill, the overarching language, requires a level of performance that just isn't reasonable for child care families. And so I feel like if we can get specific about what they're actually required to do or not do, that detail is much appreciated by the industry.
Senator Kipp.
To my good colleague, if we accept this amendment, do you then like the bill? Does this get you to a yes vote?
Senator Bright.
I'm trying. Sorry.
Senator Bright.
No, great question. And what I'm trying to do is I'm trying to get to a point where it's livable. I feel like the entire thing in general is not great for child care centers, but if we can make some adjustments, at least if/when it passes, it can be more amenable for child care centers and families.
Any further discussion? Senatorial 5. All right, we're back. Sorry, we had to turn on the sound. Senator Judah.
That's okay. Thank you, Mr. Chair. Members, I'm going to make this sweet and short and sweet. We are asking for a no vote on the amendment.
Senator Bright.
Thank you, Mr. Chair. Because of the confusion and interpretation, that doesn't bode well for the future of how this is going to work. So I respectfully withdraw Amendment L17.
L17 has been withdrawn by the sponsor. Senator Bright.
Thank you, Mr. Chair. Back to the bill, and I'll just go over my points so that you know what I'm thinking when I see things like this. This bill will no doubt reduce supply and increase cost because it comes with increased regulation. When we post fees on a website or on a sheet of paper, it can be so complicated that it will render itself ununderstandable by the average family. There are so many options out there for families, and we want to cater our services to each family as they walk in the door. I noted before that this industry is not a get-rich industry. I've been doing this for 35 years, and I have 2 weeks of cash on hand. That's just enough to cover payroll next week and our accounts payable that we've accrued over the last 2 weeks. All of the child care centers that we manage, none of them have more than 60% full. There is space out there for kids. We don't need to be regulating to change that. Most folks who get into the child care business are child care enthusiasts. They love kids. They're not business people. I'm fortunate to have a background in that and to bring that perspective to this business so that I can make those adjustments. Business acumen is a welcome voice in this industry. And we can call it private equity, but I think I would qualify as private equity. And so I would be governed by this rule on the other side of the transaction. If this is such a needed move, if this is such a needed piece inside of this industry, and the Department of Early Childhood has the ability to make a rule to do this very thing, then why didn't they? Why didn't the Department of Early Childhood make a rule that said you need to let parents know with 60 days notice before you let staff go if the business changes hands? Why didn't the department say you have to have a very detailed, specific rate sheet on your website? They could have done that. They don't see the need for it, so they didn't do it. Stakeholding. I am an in-house stakeholder for the child care industry. If anybody wants to do some stakeholding with me on child care issues, please come talk to me. You guys know my phone number. I'm available. I was not contacted at all during the stakeholder processing of this bill. That's why I'm here. It says in the bill that if the center does not comply, the departments may take further disciplinary action. What does that look like? What does it look like if we give 50 days notice to parents of a change in staff instead of 60, and now all of a sudden the Department of Early Childhood has to send their specialists out and discipline the center for not giving enough notice? Think about this in real terms. I feel like what we're trying to solve here is a pricing and capacity issue for the child care industry. There's a lot of ways to do that. This method right here is a bit short-sighted. There are ways to stabilize the financial viability of the child care industry, and this takes away the ability for investors to come in and invest in this so important work. If House Bill 1011 becomes law, we'll see child care centers close, and they'll close just prior to this bill going into effect because they don't want to be subject to the law that would come, and then also the lawsuits that would show up as a result. If I'm a mom and pop child care center and I want to retire, I have just enough change to try to skin out of here. And I have just enough cash to make payroll and pay my bills for this next month, and I decide that I can no longer do it. The regulation, the oppression is too much, and I gotta go, and somebody's there writing me a check, and I have to give 60 days notice, now I'm subjecting myself, my retirement, to a lawsuit. And I can be sued by parents that said, hey, you didn't give us 60 days notice, we're gonna take away your retirement. We understand that you got into this because you love kids, and you tried to just do the best you could and squeeze two pennies together, and you're gonna get out, but you didn't give 60 days notice, so we're gonna sue you and take that because we had to go through an inconvenience of not enough notice to find childcare. Just think about the folks who have dedicated their life to this industry, and think about what this is gonna do to them. I would ask for a no vote on 25-10-11.
Senator Carson.
Thank you, Mr. Chairman. I want to thank the senator from Platteville for sharing his expertise in this area. And as I said earlier, this bill puzzles me because we all agree we need more child care facilities. We need more folks offering this service to families. We all agree that there's a shortage of child care facilities out there. I think we generally agree, maybe not as universally, that competition in the marketplace is a good thing and that you generally get a better product at a more reasonable cost and you get more folks in the marketplace. If it's a good marketplace and people are able to make a reasonable profit on their work, you're going to have more of that offered to families in the public. So what I don't understand is why would the state of Colorado want to micromanage in this area? Why would we want to pick winners and losers? It seems to me like we would want the mom and pop providers like the senator from Platteville is offering. We would want even families to decide they might want to offer this service to children in the neighborhood, which I'm going to talk about in a minute. Or we might want to have investors come in. As the senator from Platteville indicated, he doesn't, he keeps, as I'm sure a lot of small business people do, a few weeks of capital available. After a couple of weeks or a month, a typical small business person may go out of business, and you've lost that facility. So seems to me, bringing in investors, capital, people can provide the resources to develop more of these centers would be a good thing. I remember when my children were young, my wife is actually, she was actually trained in early childhood development. So when our children were young, she chose to stay home, but we felt would be a good way to make a little extra money and provide a service to have her, in addition to taking care of our kids that were very young, bring in some neighbor children. So she was properly trained, obviously had a degree in early childhood development, we thought. Now, this was in Maryland, I will say, and it was almost a quarter century ago, so I hope it's not this regulatory environment here in Colorado yet, but I'll confess I'm not an expert like the senator from Platteville. But I tell you, we went down this road and had to apply for a permit with the state of Maryland, and this was just to take in a child in the neighborhood there that was a neighbor of ours, one child. The licensing process was fairly time-consuming, a lot of paperwork to fill out. And then we got into the whole issue of taxes. You know, when you're working for yourself, you're an independent contractor, and you've got all kinds of rules around the taxes and the regulation there on that. And then insurance. Of course, we had to purchase insurance because of all the potential liability involved there. And so we finally got, my wife finally got approved to do that. And, you know, that went on for a while. And I think for a variety of reasons, but certainly all of these rules and regulations and costs of taxes and insurance and the risks involved, eventually we just decided it was not worth it to you know, put all that effort in, and really, from a financial standpoint at least, there was very little return from it. So I think when you put all these rules and regulations on, I mean, you want kind of a foundational basis. Obviously, you got to have criminal background checks. You got to have basic safety rules. You want to make sure children are safe. But at a point, you put so many regulations out there that you're going to discourage folks from moving into that industry. And I think this is why we would want to restrict or almost say that these are not legitimate institutional investment entities, as they're called. I mean, that's the world of business. That's the world of running operations in this state and country. And I would think we would want more of it. So with that, I do have an amendment that I would like to offer, L014, and I will put it at the desk here.
There is an amendment at the desk. Will the clerk please read L014?
Amendment L014, amend Ring Gross Bill, page 5, strike
Senator
lines
Carson.
8.
Mr. Chairman, I move amendment L014.
To the amendment.
So this amendment is very simple. It substitutes the bill's safety clause with a petition clause, and I think as a general rule, I object to safety, these safety clauses being put in so many bills. I don't see the emergency here. I mean, if, we disagree on the intent of the bill, but even if you support the bill, I don't see what the emergency essentially is, and I think the voters should have the opportunity to weigh in on this if, they look at it, the industry looks at it, consumers look at it, families look at it, and they say, wait a minute, this is not a particularly good idea. We actually want these investors coming into the market so we have more capital. And so I think we ought to have the people of Colorado deserve an outlet for expressing their inevitable discontent with this bill. This amendment would replace the bill's safety clause with a petition clause allowing Colorado businesses and families to adequately express their concerns if this legislation is put into law by the legislature this year. So I think as the senator from Platteville has outlined very well with his expertise and the points I've tried to make from an economic standpoint, if you tax something and you regulate something, you're going to get less of it. It's a fundamental rule of economics. If you discourage people from bringing their capital to the table, then you're going to get less investment and less expansion in this business. If we have a shortage, and I'll take the bill sponsor's expertise in this area at their word, of 75,000 shortage of placements, facility spots in Colorado for parents who need child care. What we ought to be focusing on legislative-wise is ways that we can encourage more of these facilities, encourage more investment, encourage provide more incentives for mom and pops and small business people to get out there and start up in the child care business. And hopefully, in Colorado, they won't encounter the kind of regulation and red tape and taxes. And when you go into this business, you want to do it because you want to help families, you want to help provide care for children, folks in this business. As I said, in the case of my wife, who's trained in early childhood development, they love working with children. The children are our future. We want to make sure that they get good quality child care. And we want these facilities to be able to focus on that. I mean, that's what they need to be focusing on, not having to go hire lawyers and figure out what's the new rule the legislature put out this year on our child care facility. Well, we got to go figure that out. Maybe we got to hire a lawyer. Maybe we got to lay out more money for that. And again, as the senator from Platteville said, you don't have a lot of spare money laying around to hire the expertise, the regulatory compliance folks, and let's lay off on all these additional regulations and just focus on figuring out how we can get more people into this child care business, how we can get more investment, how we can get more funds coming into this rather than discouraging it. And so this amendment, I move Amendment L014 and ask for the body to approve it so the voters of this state will have the opportunity to weigh in on this kind of legislation.
Senator Kipp.
Thank you to my good colleague for bringing this amendment. And generally, I do appreciate petition clauses, and I'd be all over this. But recently, just in February, one of our own colleagues lost their child care on no notice, right? So that's why there is a safety clause in here, because people do need notice, really more in the case of when they lose their child care. And let's be clear about what a petition clause does. People can still go get petition signatures and get something on the ballot, right? They can always do that, whether there's a petition clause or not. So if people don't like it, so be it. But in the meantime, we want people to receive 60 days notice at the time that they are going to have to lose their child care. So we ask for a no vote.
Senator Liston.
Thank you, Mr. Chair. Well, members, I rise in support of this amendment. And personally, this is just me personally, with all due respect to whatever colleague might have lost their child care suddenly, which is unfortunate, but I don't think it's right that for anybody, because of an isolated incident that we don't know all the circumstances, that we should be telling an entire industry how to be running their business that they've been running for years and years, an entire industry, not a business, an entire industry, because of an unfortunate situation that happened to a person, whether they're a member of this body or not. I don't think that's right, and we shouldn't be doing it for any industry, saying because I had an unfortunate experience or a bad experience or whatever, that we go tell an industry, you're wrong, you don't know how to run your industry, not your business, but your entire industry, so we're going to tell you how to run your industry. That's not the way we should be doing things. That's not why the people of Colorado sent us here to slap down, whether it's the child care industry or the automotive industry or the oil and gas industry or any industry out there, that we should be telling you how to run your industry because of an isolated incident. I urge an aye vote on this amendment. Thank you, Mr. Chair.
Senator Carson.
Thank you, Mr. Chairman. I appreciate the statement by the senator from Fort Collins about the amendment. But to me, that would argue really against a bill and in favor of letting the voters weigh in on this, because if there is some type of an emergency out there, the emergency must be related to providing more child care, not less. And I fundamentally believe that this piece of legislation is going to discourage investment, entrepreneurship, the development of more childcare. So if someone, families are losing their childcare out there, the response to that should be, well, we need to get more investment in this area. We need to get more businesses entering this type of service to families and to the community. And, as I've said, as we've discussed the bill, I think it's going to have this piece of legislation is going to have the opposite effect. I don't see how you conclude that discouraging private investment companies from coming into the marketplace is going to result in anything other than fewer of the kind of facilities that we all agree we need more of. So again, I would urge a favorable vote for Amendment L014 to put this to the voters, give the voters an option to weigh in on it. We don't have all the answers here in the legislature, and we're picking an industry like this to put more regulations on. Let's give the voters a chance to weigh in on that. So I would ask for a favorable vote on L014.
Seeing no further discussion, the motion before us is the adoption of Amendment L014. All those in favor say aye. Aye. Those opposed, no. No. The noes have it, and that amendment is lost. Mr. Minority Leader. To the bill, yes.
Thank you very much, Mr. Chair. Colleagues, I rise in opposition to House Bill 1011. Just want to be clear, everybody's understanding where we are in the process. We've had a good debate. I do not like the bill. I like the bill even less now that it is in presentation without the committee report. This bill, the committee report was stripped by an earlier vote. A dozen plus people came and testified, gave their best input. The committee litigated it fully and came to a conclusion. That conclusion was rejected. I stand in resolute opposition to House Bill 1011 and urge a no vote.
Is there any further discussion on the bill? Senator Bright? No? Seeing no further discussion, the question before us is the adoption of House Bill 1011. The division has been requested. We will go into a senatorial 5. Okay, we are back. A division has been requested. All those in the chamber not entitled to vote, please be seated. The motion before us is the adoption of House Bill 1011 on second reading. All those opposed, please stand. Oh, sorry. All those in, I'm sorry. The motion is the adoption of House Bill 1011 on second reading. All those in favor, please stand. Please be seated. All those opposed, please stand. The motion for the adoption of House Bill 1011 is adopted. Will the clerk please read the title? Will the clerk please read the title of House Bill 1240?
House Bill 1240 by Representatives Joseph and Froelich and Senator Winter concerning protections for tenants who use housing subsidies.
Senator Winter.
Thank you, Mr. Chair. I move for the passage of House Bill 1240. Is there a committee report?
No committee report. To the bill. Discussion on the bill. Senator Liston.
Thank you, Mr. Chair. Mr. Chair, and members, I sit on the Business, Labor, and Technology Committee, and we heard this just last week. And I can appreciate where the good senator from Broomfield is coming from. You know, we certainly want to give people an opportunity for a fair eviction notice. But the title of this bill says concerning protections for tenants who use housing subsidies. And in the various types of housing, Section 8 housing, which is the type of housing where low-income people live as well as others, not everybody gets a subsidy. There are different qualifications that Section 8 housing applies to, that deals with federal law for state statutes. Specifically, federal law covers individuals residing in buildings that have a federally backed mortgages. Those would be examples like Fannie Mae, Freddie Mac, and many of these residents who live in this type of housing, they do not receive housing subsidies. You know, good for them. And they're paying market rates. So if the housing subsidy says that you only pay half, I'm just making this up, you only pay half, and the market rate is $1,200 a month, and you're paying $600, that is a subsidy. But if you're living in the facility and you're paying a market rate and you're paying that $1,200, these individuals should not be covered under this piece of legislation. So with that in mind, Mr. Chair, I have an amendment.
There is an amendment at the desk. Will the clerk please read L010?
Amendment L010, amend re-engrossed bill, page 6, line 4, after tenant, insert who is using a
Senator
household.
Liston.
Thank you, Mr. Chair. Mr. Chair, I move Amendment L010 to House Bill 1240. Members, what this amendment does is that this clarifies that this bill only applies to tenants that are using a housing subsidy that is stated in the bill's title. It clearly states concerning protections for tenants who use housing subsidies. As I mentioned, we heard testimony from a number of people, the Colorado Housing Coalition, the Rocky Mountain homeowners, a whole variety of witnesses that did testify affirmatively that there are tenants in these facilities that pay market rates, and they're glad to pay the market rates. They can afford them, and they have the income, and they don't qualify for the subsidies. So with that in mind, members, I urge an aye vote on Amendment L010.
Senator Winter.
Thank you, Mr. Chair. I urge a no vote on L010. What this does is it narrows it down to a direct subsidy. So that's if you are on something like Section 8 housing. Now, we know that housing is complicated and there's numerous different subsidies that the government provides. So for example, LIHTC, the low-income housing tax credit, that is a subsidy. That is something that the government has decided to say, this is important enough that we are going to invest our resources into properties through LIHTC. That's a subsidy. And those folks that are living in places that are built with subsidies, such as LIHTC, deserve to be protected just as anyone else, whether it's a direct subsidy or it's a subsidy through us as the government saying we believe in affordable housing. So I urge a no vote on this amendment.
Senator Liston.
Well, thank you, Mr. Chair. Well, members, you know, we can debate this back and forth, but the gist of the bill and what was talked about in committee consistently was Section 8 housing, and that's a federal program, and that's where many, if not most, of a lot of subsidies come from. So with that in mind, I urge and I vote on Amendment L010, and I call for division.
A division has been requested. A division has been requested. All those in the chamber not entitled to vote, please be seated. The motion is for the adoption of Amendment L010. All those in favor, please stand. You may be seated. All those opposed, please stand. The chair is not in doubt. L010 is lost. Further discussion on the bill? Senator Rich.
Thank you, Mr. Chair, and just to tag on to the subsidy issue, but I am looking at page 7, and it's at the top of page 7, and I have an amendment.
There is an amendment at the desk. Will the clerk please read L009?
Amendment L009, amend re-engross bill, page 7, strike lines 2
Senator
through...
Rich.
Thank you, Mr. Chair. I move L009 to House Bill 1240.
To the amendment.
Thank you, Mr. Chair. Now, this amendment stipulates that any portion of an individual's rent that has been covered by a housing subsidy may not be factored into the refunded difference in rent between the reduced fair rental value and the greater amount of rent. For instance, if half of a tenant's rent is covered by a subsidy, a tenant would only be entitled to 50% of the refunded difference between the fair rental value and the total amount of rent received by a landlord, tenant rent and housing subsidy included. Therefore, a tenant may only be awarded the difference concerning the rent he or she directly paid. So this is a clarifying amendment that will ensure that any portion of rental refund is not improperly inflated through the use of a housing subsidy, and I would ask for an aye vote on L009.
Senator Winter.
Thank you, Mr. Chair. I urge a no vote on L009. This isn't any refund. This is a refund that is breach of the warranty of habitability. And you shouldn't be discriminated against where your income is coming from, especially if there's a breach of warranty of habitability. And so I ask for a no vote on this amendment.
Senator Rich.
Thank you, Mr. Chair. I'm going to just renew my motion to approve L009. If a tenant has a portion or the entirety of his or her rent covered by housing subsidy, then he or she would only receive a difference refund proportional to that amount of rent that he or she paid out of pocket. I don't understand why someone who receives a subsidy would get that back. That came from someplace else. I ask for an aye vote on L009.
Senator Catlin. Senator Catlin.
Thank you, Mr. Chair. I'd like to ask a couple of questions along those lines, too, is that if the tenant is refunded and they were to get the subsidy amount refunded to them, isn't the landlord supposed to be a participant in this, or will he be charged again after that replacement money is paid? I'm not positive. Will the landlord have to pay the subsidy part, or how does that work, please?
Senator Winter.
Thank you, Mr. Chair. Again, much of what this bill does is ensure there's not discrimination based on the type of income that you are using to pay. And so should you have a subsidy, that you can have access to housing. What this is saying is, should there be a breach of warranty of habitability, then you also get a refund because you're probably having to move out. You're not there because there's a breach of warranty of habitability. And so to say that you don't get the full refund to go find somewhere else to live in the interim is discrimination, and I ask for a no vote on this amendment.
Is there any further discussion on the amendment? Seeing none, the motion before us is the adoption of L009. All those in favor say aye. Aye. Those opposed, no. No. The noes have it, and that amendment is lost. Senator Frizzell.
Thank you, Mr. Chair. So I did not hear this bill in committee, so I am super confused by this. This seems extremely complicated. And members, I really worry about these landlords because landlords are not social workers. They're there to operate a piece of real estate for the purpose of housing individuals. And, to me, expecting them to be eager participants in this subsidy application process is just yet another burden. And the reason why I worry about this is that these subsidies are really important to those who are perhaps transitioning from being unhoused to finding housing. They're important for some of our workers who make really low wages, and they need this to stay housed. And if we make this so difficult and so confusing for landlords, why the heck would we expect them to participate, right? Why would they? Why wouldn't they just say, you know what? I'm throwing in the towel. We're just going to go to market rate housing only, no subsidies, and let's just move on. That worries me a lot. So with that,
there is an amendment at the desk. Will the clerk please read L006?
Amendment L006, amend re-engross bill, page 7.
Senator Frizzell.
Thank you, Mr. Chair. I move Amendment L006 to House Bill 1240.
To the amendment.
Thank you. Members, again, in an effort to perhaps make this process that's created by this legislation a little bit less confusing, this amendment is amending language on page 7, and it's striking a portion of the bill that talks about good faith. And so the portion of the bill that talks about deeming a landlord's failure to make reasonable efforts to timely respond to requests for information and documentation necessary for rental assistance application process, and calling that an unfair housing practice. We are creating we have created legislation for the last 3 years in this building that is so anti-landlord. I can't imagine why anybody in their right mind would own rental property. I think it's just incredibly challenging. So this amendment, this simple amendment, removes some of this vague and arbitrary language from the bill, and making sure that Colorado landlords are not unnecessarily penalized for subjective interpretations of what a timely response for information and documentation is, because that's not clear. Members, that's not clear in this bill. What is timely? Is that a day? Is it a week? Is it a month? What is that? What is good faith cooperation? How is that actually defined? It's not. It's not. And I really, really want to remind us, as we make decisions, as we vote on legislation, especially as we vote on this bill today, let's let's stop making it so challenging to house people. Let's stop that. I ask for your aye vote on this amendment.
Senator Winter.
Thank you, Mr. Chair. I encourage a no vote on L006. First, I think it's really important to clarify that this bill codifies a policy that's been in federal law for nearly 5 years. It does not change the status quo. Landlords have been complying with this since March of 2020, and so this codifies something that's been working for 5 years. And this specific amendment, when we were in committee, we actually had a landlord come to committee and say, people with title, people with Section 8 housing scare me. They scare me. I don't want people with Section 8 housing. They scare me. And that is exactly why it is important to codify these protections. And so to take out the words fail to cooperate with a tenant who's applying for rental, that allows that landlord that said, folks with Section 8 housing scare me, that means she could discriminate. And so I ask for a no vote on this amendment.
Senator Rich.
Thank you. Mr. Chairman, I rise in support of L006. You almost just made our argument for us. This, without this amendment, this bill is scary. I ask for an aye vote on L006.
Seeing no further discussion, the motion before us is the adoption of L006. All those in favor say aye. A division has been requested. A division has been requested. All those in the chamber not entitled to vote, please be seated. The motion is for the adoption of Amendment L006. All those in favor, please stand. Please be seated. All those opposed, please stand. The chair is not in doubt. L006 is lost. Senator Frizzell.
Well, that was disappointing, but fortunately, I have another amendment. And I know that you're all super excited about that. One of the things that I am concerned about also, I have many worries in my life, obviously, so, is that portion of the bill on page 8, 7 and 8, that talks about, it stipulates that a discriminatory housing practice can bring a penalty of at least $5,000 in damages with no cap. Further, it talks about a calculation of actual damages must include consideration of losses that a tenant may incur as a result of the tenant forfeiting their housing subsidy as a result of the landlord discriminating against the tenant based on the tenant's source or amount of income. Wow, what? So again, I'm just trying to work to make this bill more simple for my simple mind.
There is an amendment at the desk. Will clerk please read L007?
Amendment L007, amendment
Senator
gross
Frizzell.
bill.
Thank you, Mr. Chair. I move Amendment L007 to House Bill 1240.
To the amendment.
Thank you. So, members, this amendment stipulates that a discriminatory housing practice can bring a penalty of at least $5,000, no change there, but it does cap it at $10,000 for each violation. This amendment strikes the language concerning the calculation of punitive damages for discriminatory housing practices. And under this amendment, the damages paid by a landlord to a tenant would no longer need to compensate for a tenant's loss of a housing subsidy as a result of the discriminatory housing practice. So as I mentioned, this amendment puts a ceiling on the damages that can be awarded because in this bill, again, damages have no ceiling, and that's vague considerations like the loss of a subsidy as a result of alleged housing discrimination would be factored into damages overall. So I ask for an aye vote. Thank you.
Senator Winter.
Thank you, Mr. Chair. I encourage a no vote on L007. This is in line with other discriminatory housing practices. There is a cap as well. It's just not at this level, and it wouldn't make sense to have this particular discriminatory practice be treated differently than other discriminatory practices, and so I ask for a no vote.
Further discussion on the amendment? Senator Rich.
Thank you, Mr. Chair, and I rise in support of L007. At least this amendment would bring regulatory certainty to the bill, ensuring that Colorado landlords are not forced to pay exorbitant damages based on abstract rationales. I urge an aye vote on L007.
Seeing no further discussion, the motion before us is the adoption of L007. All those in favor say aye. Those opposed, no? No. The noes have it. That amendment is lost. Further discussion on the bill? Senator Rich.
Thank you, Mr. Chair. And once again, as we're looking at these bills that keep coming in front of us, it's always about a safety clause. And I have an amendment.
There's an amendment at the desk. Will the clerk please read L008?
Amendment L008, amend reading gross bill,
Senator
page 9.
Thank you, Mr. Chair. I move L008.
To the amendment.
Thank you, Mr. Chair. Once again, the amendment would substitute the bill's safety clause with a petition clause. There doesn't seem to be an emergency for the public peace, health, or safety, or for appropriations for the support. And it seems to me that we are abusing the safety clause. I urge an aye vote on L008.
Senator Winter.
Thank you, Mr. Chair. And I actually think, and I agree that a safety clause should be used when a safety clause is necessary. And I think within this bill, that is the case. Should the CARES Act be repealed, these protections that folks have had for 5 years would go away. And to me, a very basic necessity of being safe is your housing. That is about safety. Being in safe housing is incredibly important, and if the CARES Act gets repealed, these protections go away, and in order to keep people safe, we need this, and so I ask for a no vote on L008.
Senator Frizzell.
Thank you, Mr. Chair. I'm just asking the bill sponsor, since you brought up the CARES Act, could you please expand on how the CARES Act would, the presence or absence of the CARES Act really change things with this bill?
Senator Winter.
Thank you, Mr. Chair, and thank you to that question to the good senator from Castle Rock. Essentially, what this is doing is just codifying protections we've had for folks with subsidized housing since March of 2020. And those protections were codified in the CARES Act, and given federal uncertainty, it's one of the reasons that we say this has been working in Colorado for 5 years. We think that it's done a good job. We have seen landlords be able to comply with it. We've seen it protect folks, and we want to continue moving forward with this policy, and that's why we keep talking about it.
Seeing no further discussion, the motion before us is the adoption of Amendment L008. All those in favor say aye. Aye. Those opposed, no. No. The noes have it. That amendment is lost. Mr. Minority Leader.
Thank you, Mr. Chair. To the bill. Here we go again. One more round of reaching to try to do something admirable, wonderful, beautiful. Pick your adjective that's positive. It's what we're trying to do. It's not what we're going to deliver. What we're going to deliver is less housing availability. We're going to push the mom and pops out. That's clear. This bill, protections that were in place on 3 to 5 units, they're pulled out on this bill. Those small operators operate on thin margins, don't have a legal staff in tow. They are going to be just pushed out of the marketplace. And although they don't make up the marketplace, they make up a very important part of the marketplace. They make up a set of selections that people like and might prefer to live in. We're going to have the impact, the unintended impact of a decline in small-scale rental units. There will be a tightening of the market, particularly for affordable housing, raising rents and reducing options. Broadly, we are creating a bunch of caps and imposing financial and administrative burdens on the people that provide high volumes of rental properties. And there will be a tightening, a lessening impact on availability, but more importantly, there's going to be a cost increased impact that will creep into the market over time. Landlords, especially the small ones I just mentioned, are going to have to raise rents to offset the costs, or they're going to have to exit the rental market altogether. Reducing the supply of available housing, which is the opposite effect of what we would like to have happen. The bill calls out that we're 100,000 units short, and then turns around and does a number of things that will make the shortage even worse. But potentially the most powerful and negative impact is on the folks who live in the environment where they're relying on vouchers and programs to have access to housing. Despite eliminating exemptions, the bill's punitive measures, the minimum $5,000 damage for penalties or perceived discrimination, create a high-risk environment for landlords renting to subsidized tenants. And there are vague requirements still in the bill, tried to amend and make things a little more clear, but the vague requirement to cooperate in good faith with assistance applications invites the potential for lawsuits if a landlord fails to meet standards that may be perceived differently by different individuals. And so landlords may avoid renting to voucher holders. And that is decisively, I think, a negative impact specifically for the market the audience that this bill is intended to say, hey, we're doing something for you. Sadly, I think that the net effect over time, maybe we're making it harder for you, for the very specific audience that this bill is reaching out to. In conclusion, I'm going to sound like the broken record that I can sometimes be. This is one more round of us passing policy that makes life harder and more expensive in Colorado. I urge your opposition of House Bill 1240. Thank you, Mr. Chair.
Senator Baisley.
Thank you, Mr. Chairman. Yeah, I want to repeat an anecdote that I shared in the hearing, the committee hearing on this bill. So a good friend of mine is a landlord. That's what he does for a living. He owns 30 apartment complexes. And he said to me some months ago, it was actually in the last session, last year, when a bill came up that would lean harder on landlords, on those folks who provide housing. And he said, I don't know how anyone would want to do business as a landlord in Colorado. He says, the amount of burden that you keep putting on us, he says, well, we're trying to provide good homes for people who need them. He goes, it's just untenable. And I said, well, how do you do it? And he said, I don't. He says, all of my apartment complexes are outside of Colorado. 30 apartment complexes. He lives here in Colorado. This is his home. But he won't do business in his own state. He does it across 4 other states that are a lot more friendly to folks that are trying to provide housing for people that really need it. So I'm just afraid we're chasing away the supply. We're chasing away people who have a heart for being a good landlord, for providing good housing, affordable housing, and we just keep doing this over and over and over. We are hurting the very people that I think we're looking to help with bills like this. So I also urge a no vote.
Senator Catlin.
Thank you, Mr. Chairman. In committee, when we were listening to this bill, the suppliers of the majority of apartment houses in the Denver area and probably around the state of Colorado came and said, you know, the institutional builders and all have not turned away from Colorado, but we keep getting more and more attention from them that says that they could change their mind as to whether or not Colorado is the place they want to start building more apartments and making more investments. Sometimes we have to think about how do we keep Colorado open for business. Part of that is to not regulate everything we do. This bill is an example of regulation on top of regulation on top of regulation. And questions are asked, and you know they're hard to answer because we're not positive about deposits and those kind of things. I just really would like to say this is one of those bills that you should probably vote no on because of the fact we will need units. We need them now. What's happening to our marketplace is something we can probably help if we say, look, we've got the regulations we need right now. So I'd recommend a no vote.
Seeing no further discussion, the motion before us is the adoption of House Bill 1240. All those in favor say aye. Aye. Those opposed, no. No. The ayes have it, and House Bill 1240 is adopted. Mr. Majority Leader.
Thank you, Mr. Chair. I move the committee rise and report.
You have heard the motion for the committee to rise and report. All those in favor say aye. Aye. Those opposed, no. The ayes have it, and the committee will rise and report.
Senate will come to order. Senator Roberts.
Thank you, Mr. President. The Senate has had, the committee has met and had a number of bills under consideration. Will the clerk please read the report?
April 7, 2025. Mr. President, your committee of the whole begs leave to report it has had under consideration the following attached bills, being the second reading thereof, and makes the following recommendations thereon. Senate Bill 196 as amended. Senate Bill 205 as amended. Passed on second reading and ordered engrossed and placed on the calendar for third reading and final passage. House Bill 1011, House Bill 1240, passed on second reading and ordered revised and placed on the calendar for third reading and final passage. Senate Bill 127 laid over until April 9, 2025, and retaining its place on the calendar.
Mr. Schaffler, please add Senator Bridges to the roll.
Where'd he go?
He's in the lobby. I can see the back of his head. Actually, he does need to be in here, doesn't he? Ted, do you mind grabbing Senator Bridges, please, so he can... Oh, he can hear us. Please add Senator Bridges to the roll. Thank you, sir. All right, back to it. Senator Roberts.
Thank you, Mr. President. I move the report.
The motion is the adoption of the committee of the whole report, and there is an amendment at the desk. Mr. Schaffler, please read S001 to House Bill 1011.
S001, Senator Carson moved to amend the report of the committee of the whole to show that the following Lundin floor amendment L14 to House Bill 1011 did pass.
Senator Carson.
Thank you, Mr. President. Yes, this amendment I move amendment S001 to House Bill 1011.
To the amendment, Senator Carson.
Thank you, Mr. President. This amendment deals with the issue we were talking about on the bill earlier of putting this up to the vote of the voters of Colorado. You know, my position, the position of a lot of us, is that this is going to discourage the development of new child care facilities, new spots for families, and we had a pretty close vote here, so I think it reflects some of the concerns in the public on this bill. So I ask for a favorable vote on this amendment to put this up to petition rather than have the safety clause.
Senator Kipp.
Thank you. And we ask for a no vote. Frankly, we need to make sure that people who are going to have their child care situation changed get notice of that. And 60 days notice is not a lot to ask for when you are trying to get child care. So we ask for a no vote on this cow.
Further discussion? Seeing none, the motion is the adoption of S001 to House Bill 1011. Are there any no votes? Senators Weissman, Kipp, Judah, Kipp again, Michelson Janae, Winter, Gonzalez, Wallace, Ball, Sullivan, Marchman, Cutter, Mr. Majority Leader, Danielson, Colker, Bridges, Amabile, Doherty, Roberts. Please, Mullica. Please add the president. With a vote of 15 ayes, 20 noes, 0 absent or excused, S001, House Bill 1011 is lost. The motion is the adoption of the committee of the whole report. Are there any no votes? Senators Rich, Mr. Minority Leader, Frizzell, Kirkmeyer, Baisley, Liston, Catlin, Pelton R, Carson, Pelton B, Bright, Simpson, and yes again, Mr. Minority Leader. With a vote of 23 ayes, 12 noes, 0 absent, 0 excused, committee of the whole report is adopted. Senate Bill 196 is amended. Senate Bill 205 is amended. Passed on second reading. Order engrossed and placed on the counter for third reading and final passage. House Bill 1011, House Bill 1240. Passed on second reading. Order revised and placed on the counter for third reading and final passage. Senate Bill 127 laid over until 4/9/2025 and retaining its place on the calendar. Message from the House.
The House has adopted and transmits herewith House Joint Resolution 1025. The House has voted to authorize the conferees of the First Conference Committee on House Bill 1056 to go beyond the scope of differences between the House and the Senate.
Introduction of resolutions. Mr. Schaffler, please read the title of SJR 019.
Senate Joint Resolution 019 by Senator Peltonar and Representative Winter concerning recognizing April 10, 2025 as Home Education Day in Colorado.
Julia Rodriguez.
Thank you, Mr. President. I move to lay over Senate Joint Resolution 19, lay over until Thursday, April 10th, 2025.
The motion is lay over SJR 019 to Thursday, April 10, 2025. All those in favor say aye. Opposed, no. The ayes have it, and SJR 019 will lay over until Thursday, April 10, 2025. Mr. Schaffler. say aye. Opposed, no. The ayes have it. SJR 020 will lay over until Thursday, April 10th, 2025. Introduction to bills.
Senate Bill 281 by Senators Carson and Snyder concerning careless driving resulting in serious bodily injury.
Judiciary.
Senate Bill 282 by Senators Ball and Pelton B and Representative Furray concerning persons who provide services related to veterans benefit claims and in connection therewith establishing that certain actions by such persons are deceptive trade practices under the Colorado Consumer Protection Act.
State Veteran Military Affairs.
Senate Bill 283 by Senators Roberts and Simpson and Representatives McCormick and Soper concerning the Colorado Water Conservation Board operations and in connection therewith funding of projects and making an appropriation.
Agricultural and Natural Resources.
Senate Bill 284 by Senator Exum and Representatives Byrd and Martinez concerning allowing nonprofit youth service organizations to present to students on school campuses.
Education.
Senate Bill 285 by Senator Roberts and Representative Lukens concerning updating the fee schedule for the fees paid by retail food establishments.
Finance.
House Bill 1001 by Representatives Duran and Froelich and Senators Danielson and Colker concerning the enforcement of wage and hour laws and in connection therewith making an appropriation.
Business, Labor, and Technology.
House Bill 1136 by Representatives Clifford and Bacon and Senator Snyder concerning matters related to peace officers.
Judiciary.
House Bill 1177 by Representatives Morrow and Senators Hendrickson and Pelton B concerning adjustments to the economic development rate tariff. Morrow and Winter.
Transportation and Energy.
House Bill 1207 by Representatives Mabry and Duran and Senator Winter and Exum concerning measures to address barriers to pet ownership in connection with residing in a residential structure.
Local Government and Housing.
House Bill 1273 by Representatives Basnicker and Woodrow and Senators Ball and Hendrickson concerning requiring certain municipalities to modify building codes to allow 5 stories of a multifamily residential building to be served by a single exit.
State Veteran Military Affairs. Signing the bills.
The President has signed Senate Bill 59, 60, 62, 77, 151, 171, and 188.
Delivery to the Governor.
To the Governor for signature on Monday, April 7, 2025 at 12:25 p.m. Senate Bill 59, 60, 62, 77, 151, 171, and 188.
Permission to go beyond the scope. Senator Roberts.
Thank you, Mr. President. I request that the Conference Committee on House Bill 1056 be given permission to go beyond the scope of the differences between the two houses.
The motion for the body is to grant permission to the conferees on the First Conference Committee on House Bill 1056 to go beyond the scope of the differences between the two houses. All those in favor say aye.
Aye.
Opposed, no. The ayes have it. Permission is granted. Senator Exum.
Thank you, Mr. President. I request that a conference committee on House Bill 1043 be given permission to go beyond the scope of the difference between the two houses.
The motion for the body is to grant permission to the conferees on the First Conference Committee on House Bill 1043 to go beyond the scope of the differences between the two houses. All those in favor say aye. Aye. Opposed, no. The ayes have it. Permission is granted. Announcements. Senator Pelton B.
Thank you, Mr. President. May I have a moment of personal privilege?
Granted.
Thank you, Mr. President. Members, many of you guys know what's going on in my district. I haven't spoken about it very much, but I just read an article today in Nebraska public media that made me very frustrated. As you know, the state of Nebraska wants to build the Perkins Canal, and it's in the compact with the South Platte, where they can do it. They have the opportunity to do it. They can do it, and they can even use eminent domain. So the problem is the state of Nebraska has come over and threatened eminent domain every chance that they have. They have not come over to negotiate in good faith. They have done nothing but threaten and constantly threaten eminent domain to the people in my district. In early March, a lawyer for the Colorado landowners sent the Nebraska DNR a 5-page letter saying that the law allows landowners damages if property values diminish. He estimated Nebraska's diverting water into the canal would dry up around 30 to 60,000 acres of generational family farms. That's what they will be doing. And they deserve the damages if that happens. If Nebraska proceeds with construction to the Perkins Canal, we intend to file such claims on behalf of affected landowners based upon the area impacted of the construction of the canal, the letter says. So Nebraska's response from the Nebraska DNR, he did not directly comment on the allegations of us bringing the damages. Instead, he wrote, "From the tone of your letter, it appears that you or the persons that you represent are not interested in negotiating a resolution." That is correct. You know why? Because you have done nothing but come into my district and threaten landowners. That's what the state of Nebraska has done with eminent domain. Stop. If you want to come into the district and say, we would like to negotiate something that does not look like we're going to just take over land, people might sit around and listen and might actually have a solution going forward. But instead, you threaten eminent domain every time you come over into my district. Generational farms. It is against agriculture. The very thing that you guys are trying to protect in your own state, we are protecting in ours. We are your neighbors. And you want to hurt my district, my families? Stop. This is wrong. Let's sit down and have an actual solution instead of threatening eminent domain. Thank you, Mr. President.
Senator Kolker.
Thank you, Madam President. I have an announcement. Senate Education Committee will be meeting in 15 minutes upon adjournment. We have two confirmations and one bill. I look forward to seeing everyone there at about 2:17. Thank you.
Senator Winter.
Thank you, Madam President. Transportation and Energy. Heads up, we are not meeting today. We do not have appointments. We don't have bills. We are doing that all on Wednesday. So get ready for Wednesday, but we are not meeting today. Thank you.
Senator Weissman.
Thank you, Madam President. This is just an early announcement about tomorrow's State Affairs Committee meeting. We are meeting at 2 o'clock. Usual time will be in the old Supreme Court room. This time, we have one bill on our agenda, and that is to hear SB 276. See you tomorrow at 2.
Senator Coleman.
Thank you very much, Madam President. I request a moment of personal privilege.
Granted.
Thank you so much, Madam President. Members, we're honored to have students from Senator from Aurora's district who's standing next to me, so I don't get fined. And they're from Compositive Primary. I'd ask you all to please stand up. Welcome to the Senate. Join me in welcoming them.
Thanks.
Thank you, Madam President.
Senator Pelton.
Thank you, Madam President. Oh, I have company down here this week. It's that time of the week, tomorrow morning, down in the basement. Come hear a good Bible study and feed your belly while you're there.
Any further announcements? Senator Gonzalez.
Thank you, Madam President. Colleagues, the Senate Judiciary Committee will meet at 2:20 in the old Supreme Court, and we will be hearing the following bills in the following order: House Bill 1116, House Bill 1298, House Bill 1290. I look forward to seeing you all there. Further, do I do this or do you? Okay. Thank you, Madam President.
Senator Rodriguez, Mr. Majority Leader.
Thank you, Madam President. Colleagues, as a reminder, Wednesday the 9th is the final day to order your General Assembly merchandise. Please see the docket clerk, Tammy, if you have any questions. Colleagues, we're going to recess to read bills across the desk later today, so no need to return. On that, Madam President, I move that the Senate recess until 2:30 a.m. today. 2:30 p.m. Yeah, that just means we can